All righty, you are ready to go.
Well, welcome everybody tonight to the Committee Workforce, Housing, Health and Human Services Committee. We are in a hybrid meeting, and Rachel will fill you in on that.
And as a reminder, MCB4 has a hybrid policy that can be found on our website. Board members are expected to attend meetings in person unless they have a disability and or an extraordinary circumstance. Excuse members and members of the public will still be able to participate virtually. Members who are joining via Zoom must leave their cameras on. This meeting is being streamed live on our YouTube channel and a transcript is being recorded.
Yes, it is. Come on in.
Oh, great, all right. Well, great, because I have a few issues I'd like to discuss. All right, thank you. Yes.
So we'll start with introductions first. I'm Joe Restucci. I'm the co-chair of the committee. Our other co-chair, Marie Ortiz, is delayed a bit tonight. Next.
Jesse Bodine, District Manager, Community Board 4. Edward Collins, Committee Member. Brian Sloan, Matthew Farrell, Committee Member.
Katie Stokes, community member or committee member and community member.
Liam Buckley, committee member.
Paul Ames, Public Member. Charles Victoria Archer, Community Member.
Katie Savage, committee member.
Travis Rogers, Public Member.
Roberta Barnett, committee member. Rachel Lee, committee member.
And then members of the public here tonight, we have, starting from.
Brendan Albright from Customer Advocacy's Office.
Ryan Phillips, from Clinton House.
Serena Genevieve from Ryan Chelsea Clinton Health Center.
Carter Rousseau from Ryan Chelsea Community Health Center.
William Lawyer from Rochester.
Sir,
Bob McCullough from Tupelo with that.
okay. Anyone else? No.
Judy Whistler.
Oh. Did you? Hi. So, we're gonna start, first I have to ask, Leslie, who is online from HCC, if everyone's here for that. I don't see the tenants here yet for the first item. We might have to swap the items. We're gonna bring, Leslie, we're gonna bring you and Leon Harrington over.
Tal is a resident.
Hmm?
Tal. She's a resident.
Okay,
Peter might be also. I'm not sure.
let's find out. We're also joined virtually by, Kristen Banovich from Human Incident Property. Leon, if you could, start us off. Do we have tenants here in person or is it only, virtual?
It should be on Zoom. The tenant that prepared a statement, her name is Tao Wen.
Yes, we'll bring her over. And anyone else from tenants? We have
There's
Andrew,
a possibility that someone named Caroline Eli, Andrew Morley, or
Morley, we have, yeah. Ashley Aloka, is that a tenant?
Ashley. I don't know an Ashley. No, I have
How about
Andrew, Andre, and Caroline.
And Peter McCown?
I know. I
Is
don't know.
Okay. All right, so if you're ready, we will start. So the first item, this is a follow-up. We had, and Katie Savage just joined us. I didn't hear your natural name before. I am really tired. I started very early this morning. This concerns these 18 buildings on West 49th Street that have been a series of a whole series of tenant issues, very bad conditions, and a lot of illegal activity. And we had a presentation about 3 months ago. Christian joined us in that, gave us a presentation as to where they were. We had some follow-up letters, and we are now getting a response from where we are today and what's happening going forward. So Liana, if you could just start off, set the stage, and then turn it over to the tenants as you want.
Yes, absolutely. So also just to say, hi, my name is Leanna. I'm one of the tenant organizers at Housing Conservation Coordinators. I've been working with this group of tenants since June when I came on full-time in this role. So I'm actually going to hand it over to Tao first, who has a statement prepared, and then we can answer any questions as they come up.
You have to unmute yourself, Tao. You're on mute. You're on mute. Tao, you're on mute. You have to, we can't hear you. We can't hear you.
Okay.
I'm so sorry. I apologize for that. I apologize. Hi.
So start again.
Thank you for the introduction, Leanna. My name is Tao. I'm a tenant at 340 West 49th Street. I've lived in my unit for 5 years, almost. It'll be 5 years end of this month. During my time in this block, I've experienced serious difficulty communicating and getting responses from New Amsterdam and Black Spruce regarding critical building repairs, as well as safety breaches and break-ins in our buildings. So today I'm going to be addressing our concerns that the broad, like the whole block has had about these issues. Okay. In the recent communications that New Amsterdam and Black Spruce have had with the tenant association with HCC, they've claimed that they've made several repairs, which include improvements to the intercom system. And while we acknowledge and appreciate their efforts to address these concerns, and I think that letter was sent out at the beginning of July, we have had a number of tenants confirm that they have not seen a serious or marked change in the material conditions and in their units. So, for example, tenants are still dealing with pests. They're dealing with repeated hot water allergies, heat in the wintertime, and non-working intercoms. Okay. I will also add to that non-working doors that keep getting jammed by tenants who are there and trying to get their customers, I guess you could say, in to do illicit activities. Okay. But let's get back to that. When we do report issues, it takes New Amsterdam weeks, if not months, to respond. For example, at 340 in my building, it has taken almost 2 months for them to fix a broken front door lock. Okay. It was 6 weeks. Okay. 5 weeks ago, I had to call FDNY because I was locked in the building. I could not leave the unit, my building. Okay. I could not because so many visitors have jammed the locks that it was broken. I could not leave. I had to call FDNY and they had to break open the lock. Okay. After which they told me to report it to 301, and which I submitted a managed go ticket, which is exactly what New Amsterdam has told us. That was on August 23rd. That was a Saturday, August 23rd. Okay. I reported it immediately. Okay. The front door was broken. That meant that everybody and anybody could come in and go. We only have one lock in the building. There's not 2 door locks. There's one. Okay. So people would come in going, it took them over a month to fix it. All right. So, okay. So that's just one example in my building. But we as tenants have compiled a list of questions and demands for Black Spruce and New Amsterdam. And we ask that they provide us with a number of things. The number of vacant units across all of their 14 buildings that they own on 49th Street. Okay, a staff directory with contact information to be shared with all tenants. And the reason being is that we cannot, this weekend, there has been multiple hot water outages. And this has happened 2 years ago on Christmas. There was a hot water outage for the whole weekend. We cannot get in touch with anybody on the staff when there's a hot water outage after 5 p.m. and after 5 p.m. on a weekend. Like, it doesn't happen. There's nobody that responds, okay? And we want a comprehensive plan and timeline for completing all remaining individual unit repairs and addressing block-wide concerns, okay? Further to that, our specific demands regarding safety and security on our block are this, okay? We ask that Black Spruce and New Amsterdam provide working security cameras for each first floor entrance and lobby. And I will explain why. Because we've had multiple people break in, or we have tenants who are dealing drugs in the buildings, or prostitutes, and they are letting their customers, they or their customers are jamming the doors. And as a corollary to that, we have people who are breaking into the building and stealing packages because the building doors are not secured. Okay. So what we asked when we mentioned this in a meeting with New Amsterdam, 3 months ago, all right, let's have a working security camera so that we see who the tenants are who are breaking the door locks, who they're visiting, okay? Okay, so the second thing is that we want to address the current issues with stolen packages. We also want to confirm that all roof and basement entrances are and will be continued to be secured. All right. And we want to address all the remaining issues with building intercom systems. Since management's last letter to the tenants, which we received on July 9th, tenants from at least 2 buildings that include 310 and 318, they've reported issues with their intercoms. And finally, we want monthly meetings with New Amsterdam and especially Black Spruce, because Black Spruce is the owner. New Amsterdam is just their go-through. All right. We want monthly meetings with them to stimulate communication with tenants and hold them accountable for all the conditions on our block. Today, just 2 hours ago, I saw a drug deal going on in 338 right in front on the doorsteps. All right. I saw pills being passed. This is the kind of stuff that's happening on 49th Street. It is in broad daylight. It is unacceptable for the amount of rent. And I mean, no heat, no hot water in the wintertime. Please, let's do something about this. This is just illegal at the very least.
Thank you, Tao. Liana, do you have anything else you want to add to this in terms of the general processes you have been working with New Amsterdam or Black Spruce in terms of communication and what's happened so far?
Yeah, absolutely. And I can give some extra context on that letter that we sent in July, which did have a kind of extensive list of repairs that we were able to gather from tenants that had signed on to the letter. And the response that tenants received from management was unsatisfactory. And a lot of repairs, there were a lot of claims about repairs that had been done that tenants had not seen happen. There were shoddy repairs that were done that have since broken. And there are also new repairs that have arisen that also haven't been addressed. And I think that where tenants were this summer was that they wanted to meet with management and they wanted to meet with Black Spruce, but they also wanted to be able to engage in a productive and straightforward conversation. And they didn't at the time feel like that was going to be possible when they were being told that conditions were being addressed in their buildings when they weren't. So that is what happened in July. Since then, we've been getting in touch with more tenants. I believe that we've shifted less so from tracking individual unit repairs and more towards specific safety asks that would address the issues kind of across the block. But tenants would really love to be able to have straightforward dialogue with the owners about the conditions on the block. They just want to make sure that conversation is going to feel productive and generative for them. So I'm happy to answer any more specific questions, but.
That letter was sent on July 9th, is that correct?
Response was received on July 9th. I believe we sent the letter out July 1st, I want to say.
July 1st, okay. And how many meetings have the tenants had with Black Spruce or New Amsterdam since that time?
Never met with Black Spruce. With New Amsterdam, we have not met with them since the spring, and that I believe that was before I came on full time, but I believe the last meeting was before June. And I will say that regular meetings, that was an ask that was included in that petition letter that went out on July 1st. The letter that tenants received from management was that essentially all these repairs are being addressed and they neglected to offer a meeting to tenants. So we've been waiting to essentially build some power and move towards a productive dialogue, and that's what we're hoping to do.
Katie would know this. How many units are there in total? I forget.
272.
So 272 apartments. How many tenants now are working with HCC, more or less?
I would say for our contact list itself, we have at least 60 tenants. Since I came on, between when I came on in June and now, I've lost contact with 15 tenants who have either been evicted or have moved out of the buildings because the conditions were so untenable. So as of right now, contacts with around 50 to 60 folks, which is also underlines the ask that we have for the number of vacant units, because we'd like to know what the landscape is as we move forward.
That was my next question. Christian, when we met last, there were a handful of vacant units. How many are vacant today, approximately?
Can you give me a few moments and I'll give you that information?
Of course. I'm just trying to get a rough idea of how many apartments and tenants involved. But,
I'm sorry, I'd also like to, I mean, I'm sure
oh, no, no,
have the ability.
I'm not gonna respond, I'm in the fact gathering moment for a second.
No, that's fine. There was a couple of points that I think I'd like, I'm sure I'll have ability
You're
to
gonna be
speak
able
here.
to
There's a
speak
couple
to-
of points directly, but
Not a problem.
thank you.
So roughly how many units vacant?
Again, just another moment.
While you're looking for that, Leslie from HCC, do you have anything to add to this at all?
No, I have nothing to add. Liana and Tao have covered all of the points that need to be made. And I just want to reiterate that the issues around safety are really the paramount issues that need to be addressed. And, obviously the repairs and the other issues are important, but these tenants feel unsafe in their own homes. And that is critical that has to be addressed.
Okay. So Christian, let's turn it to you. Maybe give us the information on the units, and then you can respond to some of these items.
Sorry, just another moment on the units.
Take your time. Oh,
Joe, do you think there need to be like a recap of like some of the things that?
yeah, Katie, do that. Yeah, I have to get something. If you can do that, you can do a quick recap of what's happened. Yes, that'd be helpful.
Incidents that have
For committee members before.
in this stretch of buildings, numerous fires, drug deals. A tenant was shot and killed outside of the building. There have been numerous squatters. Most of those squatters have now been evicted, but because these buildings have Article 11 tax exemptions, they house a certain amount of people from homeless shelters. And with that, there were 2 women who were sentenced to 1.5 years in prison for selling drugs, like massive quantities of crack cocaine, methamphetamines, and fentanyl were found in their possession over 2 different occasions.
So right now we have approximately 20 units that we're working to fill, 20 units that are vacant that we're working to fill right now. And I don't want to interrupt, but am I able to sort of address a couple of the comments that came in?
So Christian, Joe just stepped out. If we can maybe wait a second till he comes back.
Happy to wait.
In the meantime, do we want to see if Andrew, another tenant, has anything or?
Yeah, sorry, can you hear me?
You can.
Yeah, okay, I'm sorry, my camera's not working, I couldn't get it working. Everything that Tal said is exactly right. Pre-COVID to post-COVID, the change on the block has been ridiculous. My biggest issue is safety concerns. Just like the woman just said, once they started allowing the certain amount of tenants to come in from the Section 11, that's when a lot of this stuff was starting. That's not going to change. They're getting a tax break. There's nothing we can do about that. So if that's the case, they need to up the safety. It is ridiculous. I've never felt so unsafe at a place that I've lived. And it shouldn't be that I should have to move because of that. The boiler is ridiculous. I've been there for 13 years. It breaks down constantly. They just do repairs. Why don't they just change them out? That is a huge problem that's been going on ever since I've been there. Ridiculous. But safety, safety, safety. The block has turned into this shit, like a huge crime place that I cannot believe what I see when I am there daily. It is ridiculous. And nothing is being done about that. And we're just filling these apartments with the same kinds of people. And I hate to have to say that, but that's the fact. So go ahead.
Yeah, no, let me just note that not Section 11, it's an Article 11 tax exemption. And one of the issues that we identified at our last meeting is that there, as part of that, it's for a broad range of incomes for low and some moderate income people. But then there's a homeless component. And the thing that we identified is that the homeless component that has no support services whatsoever, that they are just referred, and then the owner has the folks there.
No on-site.
There is no on-site or contracted services, nothing. So there's no support subsequent, which is not how this is done ever, anywhere, because homeless referrals need to have social service support when they come.
Thank you. Yes.
Huh?
Who pays that rent?
And there's also, I believe, Christian, is there Section 8 involved or not?
There is.
Yeah, and there's Section 8 subsidy also. So this is a matter that we identified at our meeting about 3 months ago.
Yeah.
Something like that, that it's an expense the owner, because they're getting a tax exemption, should bear. And there is something called a regulatory agreement, a written document that is filed against the property that says specifically, here's how this all works. That document is very thin and did not require the owner to provide any sort of support services. So we've have a setup here for this owner and to fail, and these tenants to fail, because you can't just take someone from a shelter and say, here we go, you're on your own, you're fine. It doesn't work that way. Is that a good way to put it?
Well, except I thought we were also inquiring whether, what services they're being provided offsite, if.
We heard nothing. We got, the answer that we got was all about where they come from. There's no, this owner,
Nobody's tracking it or.
there is no, the process that this committee is used to and has homeless referrals is a whole support system and a contract and or people being worked with. That's not the case here. Like, for example, the project we looked at in West 45th Street in the 300 block. It's an organization, they had subsidies, and they also had very specific services that were attached to the building to make sure that the families and individuals coming in will be successful.
Right, because I know that there are some teams that go into various buildings,
Correct.
you know,
Not the
when
case
they're
here.
placed offsite, but we don't know if that's the case.
No, we know for a fact,
That
it's
they're
not the case.
getting service.
Not the case. We know that we verified that. So Christian, a lot of folks have spoken. I know you want to respond to this, but also our goal here is to move things towards resolution. And the last time we met, Katie, when was that? March?
Yeah.
March. Oh, it took a while for a letter to go out. The letters back and forth with the owners and the tenants in July. We're in October. So our goal here is to make things happen. So Christian, please respond and then talk about actions you're taking and how we can move ahead.
Well, thank you, everyone. Can everyone hear me?
Yeah.
Okay. I appreciate everyone's time and to meet again. So a few of the things I'll give an update on and a few of the things I want to address directly. And I think for context purposes, you know, New Amsterdam, we've had, you know, meetings and various meetings with several of the tenants through Councilmember Eric Botcher's office. Several of the tenants that are on the call were present for those meetings. I think we had multiple there. So, you know, we have had separate discussions with them, as well as meetings, you know, with this group as well. And now it seems that, you know, we're having meetings together, which I think is, you know, for efficiency's sake is probably best. So I do want to make it known that, you know, we've been very active in communicating and meeting and being present when asked to be, and are engaged in this process to find a resolution to make sure that everyone has the information. We've treaded a lot of information, and I don't want to go back too much in terms of, you know, a lot of the more serious challenges that have thankfully gone away in terms of the eviction. So we don't have to go back on that. So I think from that standpoint, we've made a lot of progress. And I'm sure that even the tenants would say on the call that since those individuals have been evicted, I would imagine there's been a difference on the block in general. And of course, collaborating with NYPD as we do, they've noted as well that there's a lot less criminal activity that no one wants on the block, including us. With that said, we did receive a letter that I think is from Liana from HCC, which we appreciate, and we responded in the time that they had requested that we respond. And we are more than happy to communicate and have meetings going forward, but I will just say, we received absolutely zero response from HCC or anyone from that organization to our letter. We haven't received a phone call. We haven't received an email. We haven't received a response to that letter. So we're happy to participate as we are, but I also think that in terms of how maybe the perception or how this is being portrayed that we're not willing to engage is not wholly accurate.
I want to say one thing, we're really not gonna deal with the perception issues here. We're gonna deal with how we move toward resolution of our problem, okay?
Okay.
And if they didn't respond, let's start out with coming into this committee, into this place here, we heard a series of very serious things, which you agreed with were very serious problems in this building, right? The front doors not being locked, the lack of cameras, people knocking on people's fire escapes, such like that.
Yeah, I agree. And
So the onus is always gonna be on the owner to maintain basic safety and the warranty of habitability.
Thank
And
you.
no,
then
no, Joe, no one's disagreeing with that. And certainly I'm not disagreeing with that, but what I am,
All right,
what I am stating though is that if a statement is being made that there hasn't been any response from us for collaboration, I don't think that that's accurate. We are more than happy if Liana or HCC would like to set up recurring meetings or would like to have a communication back and forth. We're open to it. We'll respond as we did before, and we will respond going forward. I think that's a point to resolution. So
that is a great commitment up front to move the thing ahead. So you will have
Yes.
regular monthly meetings with them, yes?
well, I'm happy to have regular monthly meetings. I also will just say as an update to our organization, there's been some changes that I think will be beneficial going forward. We have a new regional manager who's experienced and has, years of experience in property management. He has been assigned to the property just several weeks ago as additional support, as additional individual to make sure that items are getting addressed, that the team on the site are also addressing those items. And he will be very integral to the processing, the communication, and making sure that those things are done. And he's reporting directly to me to ensure that those things are done as well. We also have a slightly different process in terms of the property manager who's on site, who is now responsible for fewer apartments or fewer just 2 portfolios, so that he can be able to give more focus and attention to the site as well. So all is to say is that we are focusing more resources onto the property to make sure that it's managed and that everything is being handled appropriately.
Yeah, I want to note, I believe you reported back in March that you had assigned somebody new so that have less folks, less portfolio. You have informed us of that already, and I think we wrote to you about that. So now that's since March. Katie has a question.
Go ahead.
Katie, then Rachel. Yeah.
Okay, so, you said that you have this new on-site property manager and somebody else who's helping. I remember hearing that one of the initial requests at the beginning of this call was that they're requesting a staff directory. Do you think one of the things that can get worked out is that the names and contact information of these new people can be provided somewhere so that people, when there is an emergency or something, have a number to call to report it to?
Yeah,
Go ahead.
So I'm happy to provide a directory of individuals. However, I also think that we should discuss this and be very thoughtful about that, because I think what will happen if we provide a directory, the channels that are meant to be used are not going to be used. And that's just human nature. What's going to happen is that
Yeah, what Joe just said is maybe there could just be like an after hours emergency number, like a staff
There
directory,
is.
people know who the people are. And then
There
a
is.
phone number people can call.
Well, it would be good if you.
There
could
is.
It would be good. The board will ask you for these things. It's great. We'll confirm what you're saying. So it's put in writing and then it gets distributed to everybody. So there's no ambiguity about who, what, where. Okay?
Yeah.
Rachel.
There is
Oh, sorry. Go ahead. Christian. Go ahead, Christian. It's hard.
there is an after hours number for emergencies already in place. Those calls are received and then disseminated accordingly. But so that, I guess, for the record, exists already.
exists, but it doesn't actually, there's nobody that actually acts upon any of the emergencies, like when you don't have a hot water on a Friday,
Okay,
which I
right.
reported at 4 p.m.
Got it, okay.
Right, so I think we also want to know what your procedure is about logging things in, so we know how things are managed through and how it makes it up through the channels that you set up. Rachel, followed by Katie.
Thank you. So Tao, I'm gonna get to your concerns because what I'm hearing is there have been progress made, but I don't know if other committee members agree. I haven't really heard solutions to some of the more immediate questions, the urgency of heat, hot water, pest. In addition to the safety issues, these are like basic things that you need to provide, I believe, as required by law.
Yes.
To the tenants and according to a lot of the lease agreements, right? So I would love to hear some updates since our last meeting. And just to echo the kind of frustration being shared by the tenants, even as committee members, having heard these updates the last time, there was a lot of like, we are taking it seriously, we are doing XYZ things, and I'm sure you are, Christian, and your team, but are they like the new people that you're hired, to give more attention, are they giving more attention? The missing link is what we would love to hear, if you could fill us in on those.
Well, in terms of the heat and the hot water, yes, we're operating a building that has mechanicals that are not always going to function as intended. This is not new for any building in New York City. We all live in them. I think we can all agree on that. The instances when they do happen, we do address them, and I'm happy, even as record of it for full transparency, to show exactly the amount of money that we spend to repair these boilers and to repair the heating issues that are experienced. Is it fair to say that perhaps that may happen more often than the tenants would like? I'm not going to disagree with that, but is it also, is it fair to say that we are addressing those as those occur? Yes, and we have record and proof of doing so with the vendors that operate in the building. So there isn't a magic fix for that. If transparency and I guess more communication to tenants in terms of what's being spent here, there's a little bit of a
Christian, this is not about money, it's about providing service.
Okay, but
and understand that your buildings have been referred to some sort of Office of Special Enforcement at HPD, and that's not something that is done lightly. So therefore, we need to engage with this in a methodical, clear way. So if there's a list that has been sent, and I asked HCC, Liana, if you can please forward those letters, both the ones you sent and ones you received, to the community board, to Jesse Bodine. Leslie has his email address, so we can see this. To understand the way we normally work through these things, Christian, is there's a list. You write it down and you start to tick things off, whether it's the broken front door in 318 or the broken roof door in 340, whatever it is, and you start to go through these things. And if they break again, then we all come back together and talk about why and what is it. And if it's due to some troublesome tenants, then we also engage with that. We work with the NYPD, we work with everybody to figure out how to make these buildings safer. You're not alone in this thing.
No, I appreciate that. I know I'm not trying to sound defensive, although
you are. It's okay.
It may feel that way, but what I will say is for realistic and reasonableness, every time we can't solve the hot water solution. It's always going to occur. These buildings are older. We repair them. And I can't, we're going to be meeting every quarter and going through, okay, you fix this, and now this other boiler has an issue.
So if it cannot be solved, should this building even be in operation? Should it be a residential building? This is opening up more cans of worms, but to your point about, to Joe's point about documentation, I think, Christian, just really quickly, you said there are vendors who are doing the issue, doing the work, and you have documentation of it. So maybe but the residents are saying these are ongoing issues that are not being fixed as voiced by many. So are the vendors not fixing them fast enough? Are there not enough vendors? We would love to help address the issues to help the tenants. And you're just saying it's not fixable. We spend a lot of
No,
money.
no, I'm not saying that. I'm saying that the normal course of any building and anyone who works in a building knows that there's going to be mechanical items that are in constant repair.
Christian, Mr. Banovich, please, may I interject? I feel, I hate to interject. This is ongoing with all the buildings on West 49th Street. It has been going on for years now. Let me tell you what the problem is. It's not that it's not fixable. It's that you, Black Spruce, do not want to spend the money on actually replacing your boilers. We know boilers are expensive. But let me go back to like 2 months ago, the last meeting we had, where I asked to have first floor security cameras on the first floor of every building. Okay. And what was I told? It's too expensive. So if you guys are not willing to spend the money on security cameras on the first floor of every one of your buildings, then I know.
Hold on a second, because that was already committed to in our meeting of March, where Christian, by the way, Christian was new to the organization, then he's been there longer now. You noted from New Amsterdam that they were going to be installing security cameras on the ground floor of every building and in the rear yards. That's what
And they did not. And they told us in that meeting it was too expensive. I have it recorded. Please. Okay. If you're not willing to say, if you told me it was too expensive for your security cameras for like your 8 buildings on West 49th Street, I know that you're not going to spend the tens of thousands of dollars on your boilers that need to be replaced. I'm sorry. Please do not give me any more excuses.
That's not. I recall that meeting, and what we said was that we're not going to put cameras in each floor viewing each hallway.
I asked for a floor on the ground floor. On the ground floor. This is where people are breaking in. This is where people are stealing their mail.
The question: have security cameras, as you committed in the March meeting, been installed on the ground floor of every building and in the rear yards?
There are cameras on the entryways of every building. That is correct.
There are.
Yes, and I'm sorry, I have to just say a little bit of how we've spoken in several meetings before. A lot of what has occurred in terms of, the drug activity, the squatters, just so you're aware, this group has we already know about this before. So it feels like we're bringing
I had an iPhone camera. I had an iPhone phone that was stolen from my front door within an hour after it was delivered. And let me tell you, there are no cameras, Christian. And I also have it on video I actually recorded that meeting where you said we cannot afford to have a camera. Okay, on the ground floor of every single building. And I've not, and since then, I've had many things stolen. So please do not give me this.
I guess a point made here, but I want to go to Katie and then to Kevin. Katie?
So my big question, and I think, Joe, you mentioned this, as part of the Article 11, the HPD goes in and catalogs all the issues with the building, and all of those issues must be addressed as part of the Article 11.
All the outstanding violations, yes.
Outstanding violations, okay, and so in exchange for being in this Article 11, there is a huge tax break, which would theoretically free up capital to make improvements on these buildings should they be needed.
The entire point of the Article 11, for the owner taking a certain number of units at a lower income rent, is to allow that owner to pay less taxes so they can afford to charge lower rents. And therefore the buildings can operate. And a full budget was done, and the Article 11 was put together to say that income and expense with these lower rents, that these buildings could be properly maintained. So I think one of the things questions we have here is, and then there's the violation issue. This is something in that Article 11 very specific about violations. Have the violations, Christian, you were working on this last time when we met. How many open violations did you have then? How many did you cure? How many are open today? We'll go to Kevin. Yeah.
We still have, I'm sorry, I was just on this page. We still have 472 open violations. However, since July 1st as a demarker, we received 109 violations since July 1st, and we closed in that same period since July 1st, 195 violations.
Right, well, that happens because when you have an inspection to close violations, an inspector can see something and they will issue more violations. That is a standard process for housing code inspection in the city. So that's not unusual. The unusual part is starting with 472.
Well, I think since we're speaking about this, and there's I think HCC again, who's involved, and this is a big topic for us, and we would love to get support on this. This is, you know, a collaborative effort, I hope. So part of that support is we have, and I'm not going to say which units directly, but we have hundreds of violations on a very small amount of units that we are still trying to get access and court order access. We have several court dates that are coming up. We need help to get access into these units. And I think that even some of those units HCC has been speaking with. If we can find a way to collectively get access to those units so that we can treat the units for pest control, so on and so forth, that would be a benefit. That would bring down the total violation count dramatically, because we are essentially we're clearing more violations that are issued. So we are making progress on older violations, but not on some of the units that still have, you know, 40, 50 plus violations on them.
Yeah, then you get the numbers again. You said you started with 472, right? And then you.
There are
Currently 400.
Oh, currently 472, because you had.
July 1st, there have been 109 new violations and 195 closed.
Closed.
But there are still
that have been
outstanding.
Plus the one.
Yeah. So Christian, can you
No, hold it. Let Katie speak. Let Katie speak.
So Christian, you just mentioned that you said the majority of the open violations are related to a small number of apartments.
Not the majority, a lot. Not the majority.
there are a lot. Yes.
So it would help us understand.
Yes.
If you could tell us, you know.
Apartment hacks don't say what it is.
Or exactly, I don't care about the specific details, but you know, whatever it is. 200 open violations are related to 4 apartments and the other
Exactly.
272. So anyway, if you could just give us, if not now, later, an understanding of the magnitude of the violations that relate.
That are centered around those few apartments.
Yeah.
And then I'm gonna make the assumption that there are many things like a broken front door that may not yet be a violation because it was not inspected yet by HPD. That
Or
happens all the time.
Was broken before and it got fixed. and it's
You're right,
broken again.
exactly.
Yeah.
And then I think the thing that is also disturbing is hearing, we heard before, is that things are repaired, but there may be difficult tenants who jam locks or break things and create the safety problem. And the safety problem is something that we want to talk about first and foremost to resolve, because that affects everybody, irrespective of, you know, a broken toilet or something like this, or something else in the apartment. That is really serious, not just for the tenants, but for the entire block. Kevin?
Thanks, Joe. I appreciate his dialogue with the tenants of the property owner, trying to find a constructive way forward. To some degree, I feel like this is a repeat of the previous meeting we had on.
Yes.
On it. So I'm looking at the letter that was sent out at the end of June 26th, for example. So it's July, August, and September. Here we are, not 23 months. What I would suggest is some committee things, is a constructive way forward. This dialogue is good. It's a little bit he said, she said.
Of course.
I'm finding that, but we can move beyond the he said, she said. I think we update this letter. Because this letter has
Sections and details and information.
details about the background about the building, the exact number of violations that were opened on March 20th of 2025. Then it has a punch list of things to be done. So either they are or they aren't.
Right, either that list is completed or not,
Right.
and then we should also solicit from HCC, their letter, let's attach something to it.
What I'm suggesting is merge the two.
Right,
Here it is, let's say they sent out or whatever date, give a reasonable period of time, whether it's 4 weeks, 6 weeks, whatever. And some subset of this committee knows, meets with the property owner, some subset of the tenants, does a walk through the facility. Show us what you've done in the 6 weeks with the punch list.
I think we want them back here next month, because I think this is dragging kind of a bit.
Fine, then four.
Yeah.
But either it's done or it's not, then we're not going to.
It's not
I put a camera here, I didn't put a camera.
Not a maybe.
Right, yeah. And we would like a written response to the left. In other words.
They just come.
And don't leave so.
So,
If I can just finish, here's the list of the issues. Why don't you just leave a comment, here's as of such and such date before the next meeting, Here's the update of where they are.
the normal tracking. So Christian, did you respond to committee board's letter that we wrote? What's the date of that one, Kevin?
June 20 something.
June
26.
26th? Yeah, we wrote a letter of detail saying please respond.
No, I don't believe we sent a response, but I knew that we were meeting again, so here I am.
Right, so here's the thing, when we send a letter, it's general procedure, and I know you were new to the organization before, you're not new now. We write a letter if you want a response. So, we would appreciate that. So we're gonna, I think Kevin's suggestion makes the greatest sense here. We go back to our letter of June 26th, reiterate some of the things there. We update it with getting the information from HCC, from the organizer Liana, and from Tao and Andrew, any information that needs to be updated. We'll write you again, right? And what we're gonna do is we'll send you a draft of that, so you have it, because our letters have to go through a full process of going through from committee to board. And we're now on October, so our letter will not go out to November, but this meeting happens the first week of November. So we're gonna send you even a draft to look at, so you know what to expect from us. So you can really get working on this. I think this has been a problem area for a long time. And we want to figure out a way that we all work together, because we've done it many times before in many other locations. It's nothing new. Yes.
Christian, if you can, I mean, if you're involved in it, it'd be great to also include it in the letter, but I would love to hear about how you're working, or what type of wraparound services could be available for people who are coming from shelters or homes.
I think we need
Yeah,
to
I
address
think so.
I need to address that issue at HPD.
Okay.
The gap here, this regulatory agreement does not require that.
Okay.
And it is beyond my understanding to see why there would be a requirement for this owner to have X number of homeless referrals and zero obligation to provide services.
I agree.
Thank you.
Yes, Christian, go ahead.
I was saying that some of the groups that we work with do in fact provide those services directly, and I can get literature and more information from them.
But
No.
where do they provide the services? Are they providing services on the property, or are the clients expected to just go there and no one's checking to see if they're actually going?
Christian, these, as you described before, they're referral organizations. They're not providing services to these clients in this location or to make sure they succeed in this location. You described it very well before, and what you described was merely a referral system. And that is not what is normally done at all. And again, this all predates you, but this was a deal that was made with a version of HPD. Some of those people are there or not. I'm going to suggest we do a second letter that we write to HPD specifically about requirement for services for homeless referrals. How many do you have how many units are reserved for homeless referrals in total? Of the 272, Christian, how many?
I would have to get that information. I don't have it offhand right now.
50.
Regulatory agreement.
Okay, it's 50, yeah. I'm sorry, I don't have the regulatory agreement in my head, but I did read it about 10 times. So it's 50. 50 is a lot of people, and that they need services. And they're gonna be all different varying degrees of ability to succeed. Our goal is to make them succeed. That's all it is. And it's gonna be a cost associated with it.
I think there was just to give the information, the question was asked, how many units are representing, a large amount of violations. So just quickly looking, there are about 8 units that have between the 185 violations.
And are those 8 units all homeless referrals?
Good question.
I don't know offhand.
Do you have access to those units, or those ones you're saying that you don't have access to?
That's correct.
Okay, so again, see, this sort of speaks to how the work world works. If someone comes from a shelter and has a whole background of everything, they're going to be they may need assistance in independent living, how to work through things. And you may have someone who may not be appropriate for independent living. And that person may be involved in some drug activity, and that's the kind of stuff they need support. And you have to figure this out, and a provider helps you figure that out, right? And it's not a
But Joe,
provider-
I didn't confirm that those are part of the homeless shelters group.
He's on a different topic.
Yeah, I'm talking in general, right? But
Okay.
I think you confirmed before that the most troublesome individuals were folks who had been referrals. They were not.
Well, I think that there were, yeah, I mean, we know of the instances before that there were individuals who had issues that we needed to deal with and
So
address, which we did.
we'll note in our letter to ask you the question if these 8 units were the referrals, because that's the kind of thing that the board can really engage with to push the agencies to make sure something happens in a proper way, not to create havoc for you and for the people who live there.
Can I, so.
Katie and Ray, yeah.
So I remember, I thought we put it in our letter, but I don't remember exactly. Didn't we ask for there to be like somebody walking or like doing the patrol or something? For a little while?
Kevin's looking right now.
And so I guess that's one question, but then also just about the safety issues, Tao, I know that you said one of the big safety issues is that people keep blocking the doors open and or breaking the doors.
Jamming the locks.
And so I guess my question is, I don't know if the tenants have ideas or anybody here has ideas about what to do about that. I mean,
If you have a camera focused on that door, it's gonna tell you who.
right,
it's
but
gonna
it
see.
seems like Christian is saying there are cameras focused on that door.
Well, we gotta determine here.
But I was just wondering if there are any good ideas about how to address that. That's all.
Liana?
Yeah, I'd just like to interject that something I've heard from several tenants. The last time we met was 2 weeks ago. I heard reports from 5 buildings that their intercoms weren't working. And those are also buildings that they're seeing the doors being jammed because folks can't get in. It's also an issue of access because people that are on the 5th floor that have visitors coming in can't do all those stairs. And that's also one of the reasons that the doors are being jammed too. So one possible next step would be to make sure that all the intercoms are actually working properly because it is a
Well,
But
I think in terms.
may I also ask one thing? Our intercom at 340 has been working. Okay, it's been jammed. What I would really like to see is security cameras because I feel like there are the people who are jamming these doors, whether it's where it's their guests, customers, what have you, they're going to visit particular or one tenant or a few tenants. Okay, I would like to see who those tenants are whose guests are jamming these doors. And if we had cameras, we could actually see, okay, tenant 4RF, whatever, right? You constantly have tenants who are jamming the door, or or your guests are, right? And then they could be given a notice, right? That's what I mean. To me, that's logical.
So Christian, you have been making repairs, but the problem is they're not sticking or there's broader social service issues around them, right? So that's what we want to sort of parse this item by item. And I think we have a good plan on how to write to you and to move it ahead and to incorporate HCCs and the tenants' concerns. Kevin?
So, Joe, I make a motion that this committee sends 2 letters, one, everybody talk about to
Collaborative.
I make a motion, we send 2 letters, this committee, one to the property owner and copy whoever's necessary, updating the letter of June 26th, incorporating new issues and but also from the tenants, giving an X period of time to respond to fix it, leaving a column so we can put in there what the updates are.
Right.
Come back to this committee and internally could also potentially do a site visit so we can see what has not occurred.
So we'll schedule a site visit for the November committee meeting?
If you think this appropriate, we put in something like whichever one these.
I would say, let's give it a go and then go back again if we need to, right? And then
The second letter, the HPD has been discussed.
Right, I think the real issue here is that the regulatory agreement has been referred to as thin, meaning it's not that fleshed out. And if you have a homeless component, you need to have services with it. And that's all, it's gotta be worked out one way or the other with HPD. And because they are the regulatory agency to this.
So is that always the case? I mean, or is this a policy we want them to adopt here?
I have never seen a major homeless component without services attached, never seen it before.
So we're asking them to.
Do what they would normally do. So on these 2 letters, I have a motion second. Committee members, all those in favor of the 2 letters? Anyone against? Anyone present and eligible? Anyone abstaining? They carry entirely. Thank you so much for the Liana and Leslie for coming tonight, along with Tao and Andrew. And Christian, I know you're on the defensive, but the whole point of it is to move it ahead And the more we put it in writing, and then you can just produce, then this thing gets resolved as we go through to the end. Is that?
No,
helpful?
I appreciate everyone's time. I think what I want to be mindful of and for everyone to be mindful of is if we're being communicated with and we don't receive a response, you know, we're here and we'd like to continue to do that. So whether it's HCC or another group, you know, we can coordinate that. But I think if it's being said that we're not willing or able to do that, that's, again, not accurate. So looking forward to resolving some of these items.
May I
We're just gonna
respond to
cut
that
through all this. Yes, go ahead, Liana, sorry.
Not to interrupt, I just wanted to respond to that directly, if we have time.
Go ahead. Yeah.
So yes, just want to say from HCC's perspective, we're obviously open to collaboration. I know you mentioned that HCC didn't respond, but all I can do is represent tenants and their demands and support them in what they need. So in July, when we received a letter saying that all of the hot water is consistent in 328, 330, and 332, but I knew that wasn't true. All doors are being fixed as we heard about them in July when I had a tenant from January 21st whose front door was still broken on her unit and still has not been fixed as of October 7th. And also being assured that all intercoms are working when I received reports from 5 different buildings in the last 2 weeks that those intercoms were not working. We want to be collaborative. We want to work towards solutions on this block, but we also want straightforward and productive dialogue. And we need to be able to be honest about what's actually happening so we can work towards a resolution. So
I agree.
Collaboration, would love to see with management and Black Spruce moving forward.
I think we're gonna set up a framework of monthly meetings, and Christian agreed to that tonight, and then these letters will go out, and hopefully help you manage it through on both sides. Thank you both, all of you, so much for coming. You really
Thank you
appreciate
all.
it. Andrew, Tao, very much. Thank you, Leslie. Thank you, Christian.
Thank you. Thank you.
Thank you, committee, for going through that. Thank you, Katie, for trying to humor us through that little number. Our next item is a budget item from Ryan, and I want to note that we've been joined by my co-chair.
Hello, good evening. I'm Maria Ortiz, co-chair of Housing, Health and Human Services, but I think every single person in this room knows me except. Okay.
And I want to note that Maria is conflicted out from this next item because she works at Ryan, Chelsea Clinton Health Center. So I want to turn it over to Ryan, introduce yourselves and give us an update. But somebody must stand at some point.
So my name is John Lee, I'm Executive Director of the Ryan Chelsea Clinton Health Center. We're here to give a little presentation today about the services that we provide on 10th Avenue between 45th and 46th. We're going to talk about the services we provide, what's impacting us currently with the current budget cuts, the impact to the community, and the way that we provide services. I'm going to introduce Floyd Modulator, our Deputy Director.
Hello, I'm familiar with many of you. So I'm going to just talk really quickly about, let me go to the next slide. We talked about some of our history and this is what I'm contacting you to talk about, you've seen this. So we started Ryan Health, Ryan Chelsea Clinton Community Health Center as part of Ryan Health. So in 1967, we were the third community health center created in the United States in the Upper West Side. We were named after William F. Ryan, who was a congressman in the area. He's also an health there and a civil rights activist. And the Ryan Chelsea Clinton opened in 2001 to meet the needs of the community. So today we are a network of health centers across Manhattan, providing access to the underserved, both financially and healthcare wise. We currently provide services for over 50,000 patients throughout Manhattan. Ryan Chelsea Clinton in particular has over 13,000 registered patients. Last year we had over 53,000 visits. So we can go to the next slide. So our vision is we're committed to maintaining our own community health center movement. Our team of individuals are responsible to the needs of the community, as you all know, and we continually strive to provide that and meet those needs. We're also dedicated to providing high quality, affordable, comprehensive, and linguistically appropriate healthcare services to our underserved populations in the neighborhood. So before we go on, so this is our area. We can go to the next slide. So we're open 5 days a week, alternating Saturdays. See our hours there. We serve all patients regardless of their ability to pay. Our major, the majority of our patients are either on Medicaid or Medicare. We do have a population who have commercial insurance, and then also a growing population of folks who are self-pay or uninsured. And that's just sort of, most of our patients come from these zip codes, which is overlapping the community rule of 4. About 73% of our patients come from those zip codes right there. So before we move on, I want to thank the board. I think I came before you about 1.5 years ago to talk about support for a mobile medical unit. I'm so happy to say that we did get funded by the state, so we are in the process, and that's, thank you to your support. So right now we're in the process of meeting requirements. We have vendors, we have insured. We are looking at companies to actually build and fabricate the van, the mobile Carlo Russo's. It's going to be our project lead on that, and we're really excited. And again, thank you to the board, who we came before a while back and came to fruition. So, next slide.
Yeah. So yes, thank you again to the board. You guys gave us a letter of support, and that goes a long way with the New York State when we applied for the grant. Lots of organizations applied for the grant, and we were able to receive that. So we will be providing a mobile unit that will go out to help the homeless and specifically give healthcare for the homeless. We wanted to talk a little bit about budget cuts and not get too deep into the weeds because it's a very hot topic. But community health centers are in a really uncomfortable position right now. The cuts are hitting us really hard because of Medicaid and the impact of it. So when you think about the patients that we see, 71% of our patients are at or below the poverty level. 41% of our patients are kids and seniors, and 29% of them speak another language than English. 1 in 8 people in New York City are seen by a community health center. So we are really vital to the needs and the services for the community. Our uninsured population, which we see on the sliding fee scale, which means you get your income, we identify how many people are in your household, and based on that, we assess how much you can afford per visit. It also helps to cover what you need to cover for your medication. So the governor announced that 450,000 people will be losing their essential plan coverage in June of 2026, which means a lot of that will fall back on the safety net. And we basically are that safety net. So we remain seriously concerned about those restrictions and how they're going to impact our patients. Next slide. Although this is my slide, I think I would have Will explain this slide because this talks about the visits. And I think what's interesting about this slide is that you notice that the visits from year over year, with the exception of 2000, which is in the center, continues to elevate. That year, obviously, 2000 was COVID, and so we had a reduction in visits. But if you look at where we are now, the year is not finished. We've had challenges this year. All of these different things that are happening in the political arena have impacted us for the first time, where we've lost 3 providers and a social worker. Uncertain times, people don't always think that working for a federally qualified health center is a place that would be safe for them to continue to work. So we've lost some providers, and as a result of losing provider availability and visits have gone down. We've just gotten in a position where we have recovered from that, and we've had those positions filled, but it's going to take some time for those providers to be able to be comfortable with the EMR, which is our electronic medical records, and document and be able to be at full speed with seeing patients. So we're hoping to be somewhere in the 40,000 range, but our goal last year was a little under 50,000, and we exceeded that. The need is here. Our population, as Will showed that map, we go from 24th Street all the way up. And when you look at the population in between, there aren't a lot of health centers in between that space. And so it means a lot for our patients to see that population. You want to say something about this? So he's the physical, he's my number one with everything. So but I say that because when you look at the impact of that, there were other social programs that were greatly impacted this year. I don't know if you guys know about AmeriCorps, which helps us with our workforce. We get a lot of people who are able to come and get a stipend and work with us, learning about healthcare, being able to give back to the community, receive a stipend, and also get educational credits. That program was stopped by DOGE. And when that program got stopped, a lot of outreach got stopped. And a lot of ability to provide extra resources to the community got stopped as well. And so these are the kinds of things that impacted us greatly this year, and this is always the one. So we're very concerned about moving forward, but we're here for the community, we're gonna make it work. Next slide.
So one thing I'm gonna talk quickly about HIV primary care and prevention. We currently have 485 patients who receive HIV primary care. And of those, 95% of them have an undetectable viral load, which is really a testament to our case managers, right? We get Ryan White Part C funding to support that, to support our patients, to help them navigate, the healthcare system. Currently, we also have a very active PrEP program. So currently we have 504 patients currently active on PrEP. We recently were awarded a grant from the AIDS Institute. So there is money out there to increase outreach and engagement with the priority populations through events externally and peer support groups to identify social determinants of health needs and also increasing enrollment in PrEP, HIV prevention. That is supported through our prevention and outreach manager, which is a grant funded position now, and then 2 care technician roles to support them through the grant. So they go out to the community, they educate about our program, about what's available at the center, and we also do testing out in the field. So we're really proud of that. Next slide. So this, we've talked about this over the years, like what our impact in the community despite our size. We did almost 15,000 COVID vaccines administered from our site on 45th Street. We went out in the community, we went to many of your residences, Joe. We went to Harvey House, Fountain House, all over. In the past 2 years, we've done over 8,000 COVID and flu vaccines in-house, right? Because we lost, for a while, for many years, we were getting funding to get these paid for. And now the government's not paying for them. They're either coming out of our pocket or through insured, which as we know, many of our patients are not insured, don't have the resources, right? Since 2022, we also had, we've seen over 12,000 individuals who were seeking asylum, right? We went out to the community and we really actively sought to provide care for these folks. Many different reasons, that, the number of asylum seekers has decreased, but many of them continue to receive care at our center.
So, what Will said about the number of asylum seekers decreasing, has a large part to do with ICE. Either they're not available because they've been taken or they're in hiding. We may see them periodically for a visit and then they're gone for a long time. So continuity gets lost. A lot of those kinds of things are lost. But what we are seeing is a resurgence of individuals who are Medicaid eligible, who do have legal status in this country and who are able to come to our health center. So we're looking to find some space for us to continue to grow. We don't have enough dental operatories in our location, and we find dental is a big resource. Just based on the number of hours that we'll talk to you about, and every other weekend, there's just so much we can do with that time and space. And so having additional space that would allow us to really focus on mental health and get an Article 31 health center, as well as do some more dental, would be really helpful. So any help with you, knowing a good space for us to have and connecting us with organizations that have that space would be really helpful for us, getting us maybe in one of a NYCHA building or something that's being redeveloped to really help people focus on their health would be really helpful. We're trying to do prevention because with less money, it goes further when people are well. If people are ill, obviously the cost of healthcare is higher. So the more we can get into the community and be able to provide comprehensive prevention is what we want to do. Some of our machines are breaking down. Our autoclave machine basically sterilizes all our medical and dental equipment. So we would request $7,400 to help us purchase an autoclave machine that would allow us to continue.
As a budget request.
As a budget request. That would help us to keep that kind of item going. Again, that goes across medical and dental. As another budget request, emergency preparedness system. As you know, being on 45th and 46th on 10th Avenue, being right across from the Port Authority, being right across from Times Square, being right across from the Central Theater District, every imaginable threat is there. We prepare. Will is in charge of our emergency preparedness team. We do tabletops. We prepare for all of these kinds of attacks. And our systems are old, right? So we'll talk about us being over 20 years old. Our systems are older and they're failing. So our paging systems are failing. Our walkie-talkies are like 20 years old. We can't hear, so we need all of those things again, and we need to be able to react quickly. And we need the new type of equipment that they have, the really lightweight things that we can roll out and carry out. We have old things, we have things that are 20 years old. So we need some help with some of that stuff to the tune of 60,000. Our mobile unit supplies, as we'll talk about, we've got a grant for the chassis, for the full mobile unit, did not get a grant for the things that go in it. So to outfit.
So we can roll around empty.
Right, so I can have a great mobile unit and no EKG machine.
They talk about
Right?
a couple folding chairs.
Or an AED supply, somebody needs to be shocked and, we would need that, so. That's to the tune of 75,000. An intraoral dental x-ray, it's a little, sensor that goes inside of our intraoral x-ray that goes in your mouth when you take x-rays. Over time, it gets more, so it's one, it's 7,600. The things that we ask for are things that, we need to continue to maintain the support and services. Sure, we can use money for staffing, but the reality is that we're gonna continue to do our advocacy at Albany, do our advocacy in DC, work with our National Association of Community Health Centers and Community Health Centers in New York State, where we all band together and talk about the issues. We make 70 cents on the dollar, and the last time that community health centers got a raise in the wages that we received was 1999. As you can imagine, things have continued to increase in price and inflation. So every time we see a patient, we see them at a loss. And as we see the essential plan going away in 2026, that's one of the one that really hurts because the central plan got reimbursed at a reasonable rate, higher than the Medicaid rate. So for the first time when we were seeing essential plan patients, we're actually getting reimbursed somewhere close to what.
That was state funded.
That was next slide. Well,
So I'm part of the Resource Community Relations Coordinator, and I'm going to show you and highlight some of the our recent community events happening in the Health Kitchen and Cleveland area. Brian Joseph, we believe that healthcare is more than just coming to see your provider. It's about meeting people and getting a sense of our community. So we've been doing in a community in partner with the free market free stores. We do have outside the community health center, they offer clothing, they offer certain items that people can take for free. We did medical screenings throughout the year as well, which are free for our community and at multiple locations and in partnership with our community partners. Children's book giveaways, back to school supplies in September. As you can see some pictures here, we've been in partnership with this 111 and we are providing different books to children. We got community garden, that was one of the books we provided to the schools, and as well as we've been part of the National Night Out. I believe we saw some of the community board members as well. And engaging with New York Police Department and as well as with elected officials. So the branch of Clinton does get a lot for the community, not only at the health center, but we expand with different services and resources that our community needs, from food supplies, immigration services, and vaccinations, screenings, and even the mobile unit visits that we do. We can go to the next slide. So I wanted to talk about the National Health Center Week 2025, and it's happening in August 2025. We engage with over 18 partner organizations, and we brought valuable services in the community. They never seen so many organizations at one community event, and we're very proud for this opportunity to be part of the community. We also enjoy with different activities, space painting, dance demonstrations in partnership with Shape Up NYC, which you might be familiarized with. And we also distribute 100 produce bags in the community. So it was a very powerful moment for the community health center, the Ryan Joseph Clinton,
and organizations that we partner together to bring all these services. So thank you for listening. That was part of our community relations. Thank you.
Before I go to 340B, I just want to thank you all for being members of the community and actually coming out. So I won't point out who was there, but we know that there were community members from this board who were there, and thank you for being there. One of the things that we do, as Carla mentioned, is we don't just do healthcare. We work with all community organizations to connect our patients with everything. So very similar to what you were just saying in that last conversation that you had. We deal with folks who deal with unhoused individuals and what services that they have. We deal with food insecurity. We actually have a food pantry that's outside of our health center that puts food into that individual location for people to take. Other individuals come and drop food off, canned goods, fresh fruit and produce. We have people who come in and deal with people who need jobs, have clothing and resumes and discussions on how to get a good job. All of those different services. If we don't provide the service, we work with a community organization that does. And we connect our patients with everything. Because they have the respect and they have the trust with us. We find the organization, we interview them, and if we are comfortable with them, we bring them into our organization and share them. If we're not comfortable, we will not bring them in because we want the patients to feel safe. 340B is a drug pricing program that allows us to receive drugs at a discounted rate. And then we receive these specific formula of drugs at this rate. We're then able to pass it on to the patients. And the difference between that discounted rate and the full rate comes back to us as a health plan. We then invest that back into self-pay and other individuals, or if we need vaccinations or things like that. What has happened lately is a lot of different organizations are getting in the middle and taking percentages all the time. So if there's a manufacturer, they take a percentage.
They're like brokers.
Yeah, if there's another one that is working to be a middleman, exactly, they take their percentage, cutting into the amount that was originally derived to give back to the health center. So these pharmacy benefit managers were eating up the profit, and as a result, a lot of us realized we were losing funds that were developed to help us. So next slide, we decided to build our own. So we are in the process of building our own pharmacy. So Ryan Chelsea Clinton is getting a facelift. We're fixing this front desk area so that it allows for clear sight lines for security. So very similar to what you guys were just talking about, do more with less. So one of the things you do is you reconstruct the area. You can't afford a lot of fancy cameras and you make sight lines really clear. Next slide. The next thing that we're doing is reinventing our registration area, and then in the back, we will have a pharmacy that also has an immunization. This will cut out the middleman completely. So nobody will have their hands in our bucket, taking the money that was originally derived for health centers that's supposed to go back into programs to help you run. And so anybody knows anything about health centers, we operate backwards. Everyone expects us to pay up front, and then we get reimbursed. So that's why health centers work so lean and actually do it really well, because we know how to do more with less, right? So we have to put the money up out front to get the drugs and do different things that we use to take care of people. And then we have to prove we've done those services to the right people, and then we get reimbursed. And if for whatever reason we can't prove it, we lose those money, those funds. So that's why this was really important for us to be able to bring this in on site, to be able to make sure that those funds return back to the health center. And again, we just thank you all for being such great partners and being here and being to support us. We had a homeless individual who was in the front of our health center. We've been able to reach out and get services, and we've gotten services every single day to get that individual to move into services. They went for services for a while, but they're back. So what we will do is continue to bombard them with services until we get them into services, because it's not a one-time thing. It takes time.
No, it's not.
It's not. That's it.
Thank you so much.
Yeah. Thank you.
So, thank you so much. Yes, Brian.
I have a question. Can you go to slide 4, Jesse? Or it's okay if they're closed. I have a question on the 2025 numbers of patients. I know that you left PS11 pretty quickly in the fall, which I want to talk to you about. So how much of that decline in visits is because you don't serve PS11 anymore?
So PS11, so, you know, due for many reasons, that isn't actually included in our, that's part of Ryan Health. So we operate, so Ryan Chelsea Clinton is our site on 45th Street, and we also operate the Park West Educational Campus, which is on 50th, you know, there's 5 high schools in there, so we have a nurse practitioner providing, you know, healthcare, as well as a social worker and mental health services, so while it's unfortunate,
Ryan Health is the network.
It's not included in
It's not our numbers, so Ryan Chelsea Clinton was built for the meetings that were going on in the Hell's Kitchen area. And, they were looking into at that area to identify what services can be done. They wanted to create a health center, but they weren't sure if the health center would survive, they weren't sure if people would come. So instead of letting it pull down the rest of Ryan, they created another organization. Ryan Chelsea Clinton is its own organization.
So this decline is all like Medicaid patients who are not, who are. Where did they go?
So they go, it's a good question. I mean, they, you know, a lot of this population are folks who moved out of the city, right? So many of this, a lot of those members of the asylum seekers, right, the New Yorkers who actually have moved out of New York. You know.
We don't know if they're going anywhere.
Yeah.
But 23 and 24 pushed the numbers up because we had that huge influx in our district
Oh, yeah.
of all those hotels.
And we're below 2015 numbers, so,
No, that's for the full year.
Yeah, so we put out 10 with the
Yeah,
year.
but year to date.
the goal was 52,000, and
Yes.
you're not gonna.
So we're probably gonna hit about 45.
And then they also indicated that when they lost providers, that those were effectively slots that were.
So like our average, right, so some of the key metrics we look at are no-show rate and our availability, right, access to care. Our average, for the year to date is about wait to see a provider on average 13 days. Right, so we wanna make that lower as low as possible, we want to be between 8 and 10 days. You know, so we've just hired 2 new full-time providers, we've hired a social worker, and we're still continuing to recruit for another social worker and another provider.
Got it. So were those, if we assume those were like migrant visits in past couple of years, were those, you got to charge Medicaid for those visits?
Yeah, so initially, the city actually, in the intake centers, when they first came in from the Port Authority, they were actually Metro Plus, like they had insurance first, because of their immigration status, they were allowed to have Medicaid. Right, because they were not undocumented, they were awaiting asylum here, so they were eligible for Medicaid. I think as time went on, and you know, with this administration, some of the taxes they did, one of them was to not offer insurance, so they came to us uninsured, and you know, we have limited resources to help enroll folks, you know, so more and more they were becoming uninsured, because that was you know, at the point of entry, they're not being offered insurance.
At the hotels originally, at the Hertz, right, there was a Metro Plus desk to get people to meet, because the big concern was COVID to get people signed up, and then things kind of changed over a period of time, but there was an influx that was shocking all at once of patients.
We didn't have to change our workflow just to deal with the influx. There are so many people that we needed to understand what their status was, and they would say they would have died, but when we drew their bloods, the immunization wasn't effort. It wasn't a patient that had re-immunized.
Right, that was the thing we had to deal with in this committee, because those folks had kids going to school, and they couldn't get to school, like there was a lot of scrambling in those couple of years.
So I have one more question, what's the number, you know, for 2025 that like gets you, like all those asks, like, is there like I know you're probably losing money on each visit, you know, not losing, but you only 3 versus 7%, is there a number where like things look a lot better for you?
Well, so based on our payer mix, right, having X amount of folks who are Medicaid coming as our patients, X amount of uninsured, right, because we get reimbursed a lot more for a Medicaid visit than we do for commercial insurance or self-pay. Right, so we want, one of the ways that we've actually mitigated, and there's no surplus, but we're not losing in the money as much, is that we've had concerted efforts to enroll as many individuals, right? So identifying folks who are self-pay, getting them to enroll in insurance, getting our insurance partners, right? Getting Fidelis, getting Health First, Metro Plus, in the center at least once a week, that they can go and enroll in insurance, so this way, because we get reimbursed a lot more than if somebody is not insured. All right, so that's what we're doing to mitigate the losses of the patients. We're looking to increase our reimbursement from these.
Yeah, shifting the payments was huge for us this year. But if we hit $40,000, or 40,000 visits, I think it would put us in a position because of the payment shift that we've been working on. I think we'll be in a position where we'll come out. But 2026 is a new challenge.
I just have one more question on the pharmacy piece that you're building. So you have this, what do we call it, sort of like, not, you have to wait a certain amount of time to get paid from insurance, or like, how are you going, you know, if you go to like a normal pharmacy, it's like in 30, 90 days, they get paid back from the pharmacy benefit provider, like, how are you going to fund that?
How do you like float it?
Yeah, it's really expensive. It's like, you know, Walgreens only lets you have like certain medications, you can only get it a month at a time, because like they don't want to sit and wait for their money for 90 days.
And the tariffs. So there's two pieces for us. One is that we have an organization that's gonna come in and manage the pharmacy. So we contracted with Cardinal Health so that they can run the business of the pharmacy, because as you mentioned, you have to understand this business to do those programs. So they're gonna handle that portion of making sure that they understand when we can get things on the shelf, but also the 340 program allows you to shelf things a little bit different. It's a specialty. So the rules don't apply the same as a
Walgreens?
a Walgreens pharmacy, right? So if you have Walgreens pharmacy, there are things you're gonna be able to get that I can't provide you. Because they're not part of the 340 formula, right? So there'll be specific things, and the stocking of those things are built on this 340, right? So stocking is gonna be different. The ramp up is gonna be different, what's allowed to be on stock, like the 90-day supply that we put into the pharmacy to kick it off will be different. It's different.
And actually, aside from the financial benefits of the pharmacy, just from a patient experience point of view, and from a provider experience point of view, having the pharmacy in the center, right? Sometimes, you know, many times somebody will go across the street because they're right across the street from Riftway, who's a great partner. They'll say, where's my prescription? They're staying in house, right? So they can have consultations, they can be case reviews, case conferencing between provider and pharmacist. You know, the experience for the patient, you know, on that level is gonna be, you know, unmatched, so.
Well, thank you for the presentation. I thought it was very, very good. And you talked about the 70%, and I know how important it is to get paid that cost. Can you at least give some ballpark of what that dollar amount difference is? To give you an example, I ran disability services, we might have got $400 a day. But it might have cost $400 a day, but probably only got $270. So you see the gap, I'm just curious about what that gap looks like.
I think the best way to describe that is that we would get 30% less than we should get in terms of the collection. And as a result, then it's a matter of identifying for the patients that we receiving that were in the safety net, how many of those patients we receive, and how much of that 30% can we begin to get. We're still gonna wind up having a difference. But it's almost like whack-a-mole. You can slide this one over and then move over, we'll get that one, and then, so it's just constantly moving it around. What was the and we operated short for as long as we existed because of that. And all New York City community health centers and all community health centers. Like I said, since 1999, if I wait.
Roberta?
So I did want to ask about. Sorry. The budget asks here. The first, and this, I think we talked about this when you were here over a year ago, about the need for finding large space within the community. Is that a spatial need or is that also a financial need?
It's a spatial.
So, yeah.
I'm just asking for assistance with space.
Fine.
I'm asking for resources. I think for us, it's really about finding that right fit. Finding where we belong in the community, where we can continue to do this preventive work. It's gonna get tighter Looking at the essential plan, looking at what's happening with the Affordable Care Act. And when people are not eligible for essential plan and goes back into marketplace, they may fit the requirements for marketplace, but they may not be able to afford it. Because if marketplace goes up as we expected, they won't be able to pay. Guideline wise, in terms of what they make, yes, they fit. But then when you look at what the premiums are, that may not be affordable. And we find that often in our theater district, where people are working and they're gainfully employed, and then 3 months later, they're no longer on that theater. And so now they don't have funds for 6 months, right? We are a great resource for them, so.
You have described the performing arts community entirely.
Want them to try and survive and go to that next job, it's would have to be well.
So one of the things would be helpful to discuss, the first item is give us some of the requirements of what that would be for some kind of space. The community board frequently is reviewing large development projects well outside of NYCHA, individual buildings from the state, from the city, from private sector, and developers ask, what do you want in your community? Not an unusual thing. And that would be very helpful. It gives a little more specificity. So as these things come across this committee and others, we can respond and talk about how Ryan could fit into something like that. Rachel?
Yes, so I know this committee has drafted a couple of letters in the past supporting Bryan Hall's mission offering. So this time you mentioned that you're lobbying Albany and DC, or like you're intending to do that. If we were to come up with an action to draft a letter today, then who would it be addressed to? I guess that could also be a question for the co-chairs. Like, what are we asking for from whom this time?
So we would be talking to community health centers in New York State. They actually have a program that we have put together to continue to advocate on all health centers.
Okay.
And New York State.
Okay.
And so our voices are much stronger together, and we helped each other through a lot of the questions that we're just asking before, like how do we do this? How do we don't have this? How are you guys doing this? How are you managing this? And we've been sharing best practices. That's how we've been surviving all of these last minute executive orders. This order came out 5 minutes ago. We get on a phone call, emergency call, there's 25 health centers on the call. What are we doing? Like, how do we do this? How do we get this done? What are you guys doing upstate? What are you guys doing downstate? What are you doing across?
Well, we are preparing our budget request for next year for the city budget, right? What items here do you think would be appropriate for a city budget request? Is that, because we're right in the middle of that.
We're gonna solve that.
Yeah, equipment definitely.
Right, but given what you know how the city functions, I'm asking you to point and choose so we can be more.
Emergency preparedness. We need that more than anything. As I keep mentioning, we are in the hotbed and in the center of, we're pretty much on 47th. Right, so everything that can happen on the street is gonna come running in our doors. If there's some sort of emergency thing happening, everybody's gonna come and help me.
And the mobile unit, because that came from the state, should we direct our inquiry to the state?
Have you applied for grant funding for any of these items? No. Okay, so
This isn't
Fiscal
a new
has
cycle.
planned, it's a letter and you are advocating for all the community health centers, right? You're on behalf of?
I'm one of, so we're all advocating.
Right. Okay, that's great.
We are advocating for all of the people in our area.
Okay, in that case, I'm just gonna thank you for doing that, and this is a really critical need that we have, also in our district, but also nationwide, and I appreciate you for not sugarcoating.
Anything.
Yeah, I mean, these really like major incidents happening, and I know a lot of organizations, especially relying on federal government funding, are, hesitant to do it for a good reason, but appreciate you being brave and realistic about it and coming to the community for that.
Thank you very much, yes.
And then I think related to that, Rachel, right, I think maybe it's the next page, Jesse, can you go to the next page? I think you had like some specific asks about.
The last page, I think.
Oh, last page, I was gonna say, it's, oh, here.
No, I'm sorry,
Okay, all right.
the last page of the.
Not there, maybe
Sorry.
next one.
The previous page, there we go.
Hold on, there's a.
Okay,
there's a
after
page
this
that
page.
says-
After this. Put that.
Okay, yes,
Yeah, sorry.
okay. So I love the fact that you guys came in with your specific financial asks, and then you have this page with like your specific, sort of,
But who was that asked to?
and that's exactly. I wanted to find out specifically on this page where you're
When we are together asking our elected officials, this is what we've been asking all the elected officials, this is what we've been raising our voice for. We wanna have clarity so that kind of like what you all were doing with that last thing, like what Kevin was saying, like, let's be clear on what we're asking, where we're going and what's happening. Let's not have, we all have individual needs, but we need to really get together and say, what are our primary needs as a collective? And these are those.
Please,
Yeah.
Correct me if I'm wrong, but you're funding in part, but I are federal, state, and to a lesser degree local, right? You got traditional money, you got different money streams coming in, right? And Joe, correct me if I'm wrong, previous years reading through the stuff in the Dropbox, when we put a request, what we get back is, this is not a city agency, this is not a city agency.
None of this one.
None of this one?
No, we've been able to get funding.
So it might be helpful going back to Rachel's point, is there different agencies or people that we're reaching out to for different asks? So for example, the mobile van, who would that go to?
That's New York State, but what agency in New York State?
This Department of Health, right? Or
UAH.
actually the dormitory authority, right?
Dormitory authority, got it.
So, so for these asks, which are not so much.
These are policy.
These are policy. I guess I'm wondering, you mentioned the sort of overall group that advocating for all of the community health. I guess I'm wondering, like, do they have any legislation they're supporting right now? And you would like us to,
Yes, I
like,
can.
is this wrapped into something that we can specifically support right now?
Yes.
Yeah.
I can send them to you, there's a bill by Paulin, there's a couple of bills by Paulin, yeah, definitely to help us with.
So then I'm gonna,
Or to be alive, so I'll send that as well.
So that means-
I guess I would suggest then, for maybe a couple different letters, but maybe
That's
there's a
correct.
letter. Once you send us the information about like. Who's working on these efforts, that then I propose that we draft a letter supporting that effort.
yes,
Once we know who to draft the letter to,
this,
sort of supporting these policy issues. Right?
and then the second ask that we should do here tonight is, well, we're in this discussion, is the 75,000 for the supplies for the mobile unit to New York State Dormitory Authority and Department of Health. We're gonna talk about the city budget request for the other items later in our meeting anyway, and that's where that belongs.
Okay.
Because this is a separate, it's very much a separate letter to the state about
Can you
it.
just toss in those 7,500
No.
ones here?
I'm putting that in the city stuff.
Okay, great. So it's
I'm
three
trying-
city asks,
yeah.
one state
Right,
ask.
trying to get the asks in the right bucket to make sure they hit in the right place, otherwise we're.
And then these policy asks
Right.
in a separate letter, that's no,
So the motion, so except for the city asks, which will move later, because that's our
the
discussion.
three city asks.
Right, three city asks, that's
And
number
the
three.
three city asks are.
It's gonna be discussed in number,
And,
and the 60.
It's medical equipment and,
Okay, so the last three on the list.
Yeah, it's the emergency preparedness, yeah.
The the typical response we will get from that, which is not to, we should not do it, is that the center should apply to DOHMH for the funding for that
Mhm.
and not, and they won't grant the request, but that is, we can absolutely put it in there.
Exactly, and it elevates it
Yeah.
and escalates.
On record, I'm sorry, I don't wanna go down a rabbit hole, but I'm looking at the stuff in the Dropbox. It repeatedly says for Ryan Chelsea, agency does not support this. Remove request, explanation, this is a community center that operates outside of the purview to the HMH. So.
Correct, and what happens is that elected officials then put in their funds to help support something.
From councilman.
And or president and or.
But not from the city itself. But not from the city itself.
It goes through the city.
Yeah.
You have to get a no to get a yes another way. How's that?
The budget is ultimately a political document.
That's
to create
correct.
The priorities, and while it's focused on the city budget, to the extent that is fungible from other sources, I think it's appropriate to list.
We frequently get
Oh, don't
things.
take me wrong. I
No,
wanna
you're-
advocate my.
Everything's
I'm talking strategically, how do you?
It's almost like when you apply, when you go to the doctor and you try to get a procedure done, the insurance rejects you. They appeal it.
Coded differently.
Coded differently, or you. You have to
You
get
have to
it.
appeal twice to get the yes.
I get what it's close to get, it's a rough example.
So you're gonna now restate,
But I think Rachel had a question. Did you have a question?
Well, will we be ceasing the elected officials?
always and all these things, always that question. So Katie, restate the motion for the 1 and 2 pieces, not the other, the 3 for the city.
So I move that we write a letter to whoever we're told we should write a letter, once we talk about it. To support these policy positions on page something of your.
Regarding 340B.
Yeah, regarding 340B. And the PBMs and things,
Mhm.
so that's one. I move that we write a letter to the state requesting funding for the new mobile vans.
So the outfitting of the van.
Out the inside, the stuff that
Mhm.
goes inside for $75,000. So those are two separate letters that I moved on right now.
Is there a second on that motion?
Second.
Second by Katie. All those in.
I mean,
Sorry, I looked up at her, so yes. All those in favor, is that? All those against? All those abstaining? All
Yeah.
present not eligible? Done. Okay, so that is done, and thank you very much. I guess we're not gonna have the other items a little bit later. Thank you so much. Let's go, we have a short presentation by Kevin, who is gonna talk to us about the report. He sits on the Mount Sinai Community Advisory Board, and we'll go with it.
Thanks. So the sake of time, I'll try to be as quick as possible. There's 3 things I want to touch upon. One, just as a brief reminder of public service announcement. Thank you for everybody on the board and the community who's sent back the annual district meetings. It's greatly appreciated. I passed out flyers. If somebody didn't get it, please let me know. Please continue to pass it out. You're in support, especially as we're going into budget X time. Second item is, I appreciate the feedback I got from everyone, actually. We'll see if we try to work towards, getting the HHS committee, especially following this presentation, involved somewhat more in health issues. I'm willing to carry most of the water, so to speak, but welcome anybody from the committee who wants to participate in any way. In short, this would be an effort to start off by creating a survey that could go to the community, asking what health issues they believe are most important to them, or that impact the community, as well as what health issues or services they would like to get more information on or have more access to. I can start off by reaching out to city agencies such as H&H and DOH, HMH, or health facilities in the community, such as one of the just left, to see what they offer in this regard and have input on the survey. The survey can be worked on and developed with key questions to elicit good effectively. We can take the results and see what we can do on issues such as a once-a-month health van in a particular area, addressing a specific health issue or need, education, advocacy for health issues and so on. We could look into having educational components at this meeting. I can also know housing, put together a map on our community board website showing health facilities and services in the community.
Yeah, maps for everything else, but not for that.
And I'm open, welcome, everybody in this committee, your input, feedback and suggestions, and we'll be glad to work with anybody on it.
And this is analogous to Barbara Davis was co-chair from the Actors Fund for years, and she worked in seniors. And we did this whole survey about senior and it was like the thing that moved everything ahead by just thinking about it, stepping back, getting information, and then what initiatives can we take? So thank you, Kevin, for willing to take this on.
And then last thing, go through this is, last week there was a community advisory board meeting from Mount Sinai West. This is their info. It's the best of the degree that I can explain it, I'm not Mount Sinai. It's not giving help, advice, but if we just go through the slides, you'll see that and they're starting to amplify an urgent care where you can do a video visit or a phone call. And the concept behind this is, if you can't wait to see your PCP, your primary care physician, but it's not something that requires you going to the emergency room, you can get see this. And what's good about this is they have translation services available. So if we go to, the next slide. You can, do this as a video visit or a text visit. On to the next slide. That's what I was talking about, and powering through this. Next slide. It's Mount Sinai, they have an app, you can also go through the website. Next slide. When you go there through the app, you click on access virtual care. Next slide, gives you a background about that. Next slide, an overview. So it is staffed by MDs and physician's assistants. Cover prescriptions, specialty referrals, labs, imaging, feeds. And it's covered a couple of states, New York and Florida. And this is snowbirds, really great. Monday to Friday, it's open from 8:30 AM to 8:30 P. Saturday and Sunday, 9 to 5. You go to the next slide. You see common diagnosis. So this is common things that people may go to that have problems. Again, you can't wait a couple weeks to see a primary care physician, but you don't have to physically go to the emergency room. It doesn't arise to that level. Next slide. That's some of the insurance information and some of the copay costs. Next slide. You can complete a questionnaire, give your feedback. Last slide. As I said, staff, MDs and PAs. So just passing on information. You want more information that I went through, be respectful of the time. Let me know. I can hook you up with my doctor or someone from outside. Any questions about that? Yes.
Just would you provide a little more color on the background, like why this came to your attention, or like who asked?
Community advisory board.
Mount Sinai, most hospitals should have a community advisory board.
Right.
The community board gets a person on the CAB.
I guess my question is more, what has propelled Mount Sinai to conduct the survey? And what I'm trying to get at is I am aware of, also by being on the
They're
chain.
not doing a survey.
The survey part was different. Those are two separate things.
Okay,
So
so
the
this is
survey thing-
informational about the urgent care?
Yeah,
Virtual
a
urgent care?
report of what
Okay, but
happened
my,
at the cat.
but my question still applies, because I'm wondering if it has anything to do with their closure.
Mount Sinai is not, this survey is not about Mount Sinai at all. This is Kevin. Go ahead.
Let me try and break this down.
Sorry, the logo was on every slide, so I guess I was confused.
No.
I talked about,
This is Mount Sinai. He talked about two different
I
topics.
talked about three things. One, thanking and asking.
It wasn't, yeah.
about the survey.
Mhm.
Number two, I'm gonna try over the next couple of months to work within this committee and Joe Marie and Jesse and others to help on behalf of CB4 put together an amplified health presence dealing with health issues, starting off with a survey. That's our own thing. That's only,
Okay.
has nothing to do with Mount Sinai.
Then the urgent care portions.
Is Mount Sinai at a community advisory board meeting poured out that this is one of the things that they're amplifying. Since I sit on the cab, I want to report back to this committee,
Okay.
since it's a health issue, what was going on at Mount Sinai West.
Okay.
This is,
Does it in any way connect to their closure of Beth Israel, that they're promoting virtual care to address those needs?
they didn't mention that, and I would doubt it. It's probably one way to try to amplify the patient population of services at that particular facility.
Okay, that was my curiosity, but thank you for clarifying.
You're very welcome.
Thank you so much, Kevin, for that. I think getting the idea of, and working through it, and if there's anything, maybe next meeting, like, what would a survey look like? How do we do this? Like, so we can discuss it.
And again, I went through it quickly, just have respect for it.
I'd love to just highlight Kevin's participation, so Kevin also separately from the first thing you mentioned, which was our own current survey, statement of district needs survey that we put out every year that provides sort of a back of the napkin, broad strokes, like what is the community concerned about, that we're not hearing on a committee level on a month-to-month basis. Kevin took it on to promote that and get the word out. It was, I think, nearly doubled or nearly tripled the response rate, so.
Wow.
Nearly single-handedly. So whatever he's gonna do with your health survey, know it's in good hands.
Let's move on to our next item, and it's our budget, the 2027 budget. Roberta, where do we leave off, and where do we go from here, besides the new items that we'll bring up for?
So at our last
meeting, we deferred the full discussion of this particular topic on the statement of district needs to this meeting. I think that the ask was to take a look at the list for the Housing, Health and Human Services Committees, both capital and expense, as well as to look and see if there were any letters that we should be adding new items. It may be that the most productive way to do this, they're not, a large amount of housing, health and human services items to put up the HHS, and we can go through capital and then expense, say, this is something we should keep on there. Either if it is ultimately something that has been done, we would just put it perhaps under something called continued support.
Well,
If we have-
look at 26 or 27.
No, but I did something specific. Let me, don't pay attention to me, listen to Roberta.
Away.
Yeah.
Jesse, read this on for presentation purposes. Good.
So we'll basically go through those. If something looks good, if we want to keep the ask, it is, the agency has not responded to it, the agency says, resubmit, talk to your elected officials, we keep it there unless we believe that it's been addressed, or, and then we can also get into, the prioritization. And the prioritization is, this year a little bit different than it's been in the past. It is, we can still collectively look at both the NYCHA, HPD, and Department of Buildings requests together, but each agency will receive the priority list of asks separately.
Within
that's,
the agency, right?
yeah, so if we say that, Jesse, please correct me if I'm wrong, but if we say that, the HPD item is number 5, but it's the first HPD item on our list, HPD will only see that as our number 1.
It's even further than that. That's what was been happening already. But what the.
This change just happened, guys.
This literally, we just learned about this over the last week and a half. So, we have historically always had to send in a collective prioritization of our capital and expense requests, from all committees. So the budget task force was given a responsibility of looking at your guys' priorities, looking at, WP's priorities and deciding, what is more important, and the reality is. So the reality is though, that information then gets sent to the city agencies and broken up anyway by agency. It's not as though like the Parks Department sees a list and says, they think housing is more important than this park, so we're not really gonna pay attention to them. That's not what happens. They get only the parks requests. So we've been advocating from a district manager standpoint for a while now. It's like, why make us do this? Why make the committees have to decide on what their top.
Area X is better than area Y.
Why, you're right, exactly, saying, this housing development site deserves to be number 1, and this housing development site deserves to be number 2, or this health issue deserves to be number 3 compared to a housing site, right? So now it's basically, what it does is, you guys on a committee level do not need to create a priority list of your top 10 priorities. You can do it by agency. So if you guys look at what it does, it makes it a little complicated. If you guys look at it though, you wanna look at your priorities list from last year and say, if you pull out all the housing ones. And say,
HPD, Department of Health, Social Department of Homeless Services.
right, yeah, and say, okay, you know what, we looked at our housing and we still think these are the most important. And I mean, these are in priority order. We can just go ahead and move that along and just say those, we're gonna keep those the same. The health department stuff, you can, you're breaking it out by agency. So, you can obviously prioritize within an agency if you want to, but I don't think the pressure is on to say if HPD sees 3 priorities from you guys on housing issues, they're gonna say, it's number 3 and it's not very important to them. It's a lot different to say that was on number 30 or 40.
But more important, we're not putting a park against a homeless service, against a DOB inspector.
The real change will be then coming to the budget task force, which Roberta chairs right now, is that it's not gonna be put on their shoulders to have to create a master list.
And balance.
You would just be sort of basically forwarding
committee's
on the committee's priorities for each agency. And the document at the end will not have a master list. It will be broken out by agency. So you'd actually be able to see your HPD priorities versus your parks priorities in a very separated form and not feel like you're having to weigh them out and compare each other. Yes, Rachel.
I do have a tech question on that. So tech question, are we still alive?
No, yes, we are.
Okay.
I just removed, was the
Projector.
projector.
Okay, second, I was totally paying attention to everything you were saying. The question is, in addition to the committee input, how do we reconcile then the results of the survey? And then when and where can we see the survey?
So the survey is done through the budget task force, so I would attend the budget task force.
And just to add a little bit of information there, I will provide some version of the survey responses, but the survey responses are primarily utilized to shape the narrative as well as to provide committee chairs. If there's additional information, maybe something we've missed in committee, can forward it there, but typically it's not typical for the survey responses to drive a specific ask that we have not already indicated.
Okay, I think that's,
More supportive of those asks. right?
Yes.
I think that kind of is what I heard, because I did listen to the budget task force recordings. And when this question came, I think either in the last one or something in the previous cycle, what I heard was we typically focus on what the committee discussed in the past year, aka that's why the letters are given, right? So this survey is somewhat informative, but you're saying it doesn't dictate our priorities necessarily.
It does not dictate our priorities, but within the narrative of the statement of district needs, we highlight top issues as well as trends. And the survey typically dictates that narrative piece. It has not happened that there is a divergence between the committees and the surveys. But if there was, the budget task force would be responsible for figuring out how to thread that needle in the statement document.
Okay.
It's not pretty. This is not the way I wanted to show. Yes, I'm sorry.
Oh, well.
But you can. That's the thing. All right, so you guys can, you guys have this in your Dropbox already.
Yeah.
But, these are your expense requests. I don't know how you guys wanna do it. You wanna do capital or expense first?
So you have it up to the
Yeah,
expense.
thumbs up.
Yeah, so, these are your expense requests from last year with so what you're looking at, I'll go line by line. Priority number is based off the master list from last year.
Right.
So I really wouldn't pay attention to it. It's gonna be reshuffled anyway, and then we're not doing it on the master list anyway. But you can see where you fell out, right? 2, 8, and 16. So
These are only 3 expense requests?
no, you got all.
I thought it's more,
You
yeah.
got all of these. So then you got your agency, for some reason, the budget code got mushed in there for some reason. That's why you see that doubling up. But it's the agency, the request type, the explanation, that's that's what we wrote. The response, which is the initial response from the agency, and then the final response, which is in the office of management and budget. I forgot the MSAP, yeah. Management and budget, which is basically the final response at the executive budget, which I would say 99% of the time always just reconfirms the agency's response. So one little thing here that came up last night for Ace is to understand also is the Department of City Planning, for whatever reasons, was given the responsibility of overseeing this entire process for us. Why Department of City Planning is the one to do it, not really sure, but it is. And so they chose to interject themselves a little last year, which they are not gonna do this year. And that line that says remove request has never been in there before. We've never seen an
Ever,
agency
ever.
say to us, oh, you should just remove this request. You don't know what you're talking about. Why they did that, so I just wanna understand that, so we don't get all bent out of shape when we read these. Or decide on them, is that their mindset was they were trying to be helpful to educate. A board to say, the agency is saying this, so this is why you should remove it. You know, that's our choice.
Outside of the very
Right.
clear
So-
explanation Roberta gave, which is political document anyway, and that's why it's there.
So that's what I just want, so that's the explanation, again, I don't know how you guys wanna do this tonight, but, you know. Someone wants to.
Well, I think one of the things that's disturbing is that we should have found out if these things got funded one way or the other. So like, next, item number 8 is the Ryan translator thing. Did it get funded? Either from this source or another, we don't know.
Well, except that that's not one of the things they asked for this evening, right?
Right, but this is the prior year, like,
No, I know,
We
but
just
you're thinking like, just for purposes of us asking for stuff.
this is expense though, they asked for capital stuff.
If we wanted an answer, the best people to have asked would have been Ryan.
Ryan, I mean,
But.
they were sitting here.
I do work there. Yes. And so we can follow up on that, but I think to Katie's point, if we're going through all of these and we're trying to figure out, do we keep something, do we
Right.
remove something? We might decide that we go line by line and maybe we decide to remove something.
Yeah, that was my general idea. We should ask the, the applicant, someone who asked for this to be from the budget, have they been funded one way or the other, and then to clean it up, that's all.
Sorry, but do you know, do they have translators?
The need is not the same, and there are additional machines and a new
Okay, so maybe-
service, but I think follow up with, is what I think.
Can I also just make the point, I'm not taking notes, so
I-
you're all, okay, great.
He is, and we have a video.
It's gonna be real clear.
That's it.
But I'm also not rewatching. That's all you.
I will provide that service. Between
Yeah.
Roberta's notes and yeah, we'll figure it out. Okay, so,
So I guess, I don't
Go-
know.
no,
just like
yes,
the
yes,
first
absolutely, yes.
Just like the first one, do we still want more outreach?
the question is, we have to find out whether the Be Heard has definitely been funded more, and to a degree, it's been funded more, right? To understand the priority part, that's it.
But I mean, it seems like we hear from the community a lot that they would like there to be more. Say it again.
Behavioral services.
Yeah.
Yeah.
So it seems like that should still be an ask.
Well, I know, but it's the specific thing.
Right, so I'm wondering, like, did we just take out the reference to be heard?
Well, yeah, I mean, I think we put, Be Heard was new last year. We didn't have that. We used to always this used to be expand street outreach. So
Yeah.
that's all it was.
Yeah.
And they would say, we did it. And we'd say, well, we still want more. And then we'd say, and they'd come back and say, we did it. And we're like, we still want more. We're our community as an
Extraordinary need.
extraordinary amount need.
And that's actually,
So we add, this language was added by you guys,
right, so
from all the different.
I would say take out the Be Heard, because we still want the behavioral outreach, and everyone is screaming for it, so that's a major need, right?
All right.
And just when you're taking out the Be Heard, do you want to separate that into a separate ask, or do you want to remove the Be Heard reference?
I just think the Be Heard reference was the new program kind of thing,
So take it out.
yeah. But we still want the general expansion of the kind of services,
If there's a data to back the ask, that's so.
right?
All right.
The next one, we need to get back, ask Ryan if there's a need still, and then we can respond. I think that was a time and place. Right?
Yeah, we're in expenses, right? And so, I mean, I just think though that they came last year very clearly with this request.
Right.
And so they didn't this year.
Yeah.
And so obviously, even if they might still need it on some level.
They didn't ask for it.
They clearly didn't ask for it. Their priorities, I think they prioritized the things that we saw. So I think you guys could feel
I think we have,
comfortable just switching them out.
I think we have a co-chair who can just check quickly to find tomorrow, let us know.
That's fine. I'm just saying.
I mean,
If there's an expense request in there, then you can want to switch it out, I think.
Right. Then we have emergency repair program, which was number 16.
Here, right, so the agency supports it but cannot accommodate it, and then OMB says they'll try to accommodate this issue within existing resources. So, but we certainly know that this has not changed.
No.
This all came out of, you were just talking about this, through that building, the.
410, 412,
Yeah.
West 46th Street.
Yeah, this all came out of the request that there needs to be expanded in funding for this program, for specifically these buildings.
I would recommend we leave this thing, because we're gonna have another one of these buildings coming along in the next budget year. I mean, the ones on 45th Street now is a huge issue. They have like 560 violations, owned by Oak Shalom, who also owned the 46th Street buildings. NYCHA elevators.
Is there a way, just based on all of the testimony we've heard this year about, Chelsea, Elliott, I was like, can we prioritize the bridge plan or the?
It's not funded by NYCHA. The bridge plan is funded by Related.
The other piece of this that I will note, and Clue has a little bit lighter of a load here, is that last year Clue took that up as a single ask, and so I'm not saying we should defer to Clue as to how to pick it up, but given that we have limited time and many asks, it might actually be easier to have Clue take it up again, and obviously we can add, opine on that once later.
Yeah, but I would clarify it. The NYCHA one that we need the elevators for is Harborview on 55th and 56th Streets, because they're not in the PAC program. They're not getting funded through this stuff. And they have elevator issues.
Or should we put that in?
I would say put it in Harborview. Right, but as for, it's a capital? We're an expense. That might be in capital.
Yeah, there's.
This is about staff.
It's about
Two
staffing.
different elevator asks.
Yeah, so we talked about this last night as well. So for a very long time, there's been this issue of saying elevators are broken, we need to fund the
Capital stuff, right?
repair, which is millions and millions and millions of dollars about elevators. And then there's the issue of staffing the repair, the consistent repair and maintenance of those elevators, and that's what this is about.
And this is about elevator maintenance. And having, yes,
So I think if you want to include the capital, I think you still want to include the expense, which.
I would agree, yes.
So you're saying leave this as is?
Yeah, I'm not saying it's what priority number it should be. I mean, it's under
Yeah.
public housing. You might have something else under expense under public housing. I don't know. I don't think you do, but you might, and so.
And the budget task force, if there are multiple committees submitting, like NYCHA, then the budget task force would probably be able to prioritize this.
Yep.
Yeah.
Yeah, just letting you know with that line item, I have seen every drawing of all the elevator drawings of all the buildings that you're talking about. They do exist, and I have some of them through the roles that I've talked about.
Yeah, the problem here is that it's the qualified people to maintain them. That seems to be the expense.
No, but what I'm saying is the source of what the configuration is of each.
That is very good to know.
There is documentation that's very accurate
And detailed.
and detailed.
Next item is DIFTA. Sort of like we're just ignoring the numbers on the side and saying, for our committee, for the various agencies, how do these fall? Because we have to separate them out. So this is Department of the Aging.
Yeah, I don't think we have another Department of the Aging, so
I think this is it.
One.
Right.
I mean, unless we want to create one based off of the letters, but I don't think you really, what? It's been a while since we've had you guys have come back, so.
Right, we have to,
I mean,
we have to just inquire because we have a time frame in this budget.
well, yeah, I mean, I think you're still voting tonight.
Yes,
So,
yes.
yeah, you guys think it's important to keep it?
I guess the question is, I mean, there will always be more need for food, but assistance, but the agency supports and can accommodate, and they are monitoring and provided to determine if there is a need at these sites. If they've determined that they have met this need, do we disagree with that agency determination?
Yes.
Okay.
That's pretty much the normal process, because we certainly have enough meals for the elderly, and they don't. That's just so. Next one is HPD, and this is housing attorney at HCC. We need to ask them that question, because I believe that has been funded.
Oh, right.
Right, but you gotta just ask the question.
We also had that. Right?
Yeah, I know. Yeah, but it's right, gonna be asked.
That's a big win.
Yeah.
That got funded.
I
You guys
guess
should be happy with
even if they added one last year or this past year, it seems like that's one of the things we've heard about is in connection with the NYCHA efforts, is that the tenants have said that they want more legal representation reviewing leases and contracts and things.
Right, but this is
So
very
we-
much HCC though.
But there, I believe, isn't NYCHA contracted with Legal Aid Society in some, I don't know. if we're-
They are, but believe it or not, tenants have now gone HCC of Chelsea NYCHA too.
So I guess I'm just wondering, like, should we be asking? Or maybe I'll raise this. Never mind.
No, but I think you got the right angle.
Yeah.
We gotta ask this question because this need may have been settled,
Right.
but is there a new need that has developed that
Exactly.
could use additional?
Yeah,
Got
that's
it.
what I think. So maybe if we can add,
We
or
have invest-
anyway, leave this.
I believe it, yeah.
We're gonna have some serious like motion pending investigation here.
Yeah.
Because we have a lot of this to figure out. Next thing is, the DOHMH,
This has been a long time.
this is a long time.
This is one of the leads.
This
What
is-
is this one?
It's new HIV, it's because our demographics continue to have the highest rates of HIV.
Oh, no, I'm sorry.
Is that
Yeah, yes, that one, we're still,
Yeah.
yes, I didn't.
Didn't they just say tonight that they have like a big grant? That's good.
Which is, yeah, that was the one question, if that. Like outstanding ask has been funded not by the city, but through. I think they said, the, AIDS International.
No, AIDS Institute, but this is outside, this is outside of Ryan. This is Housing Works, these are all the providers.
And then there's also another place on 50th Street, not listed on here.
Yeah, we just listed those as being the help, places where people go. I think those tracks, I mean,
Would it be helpful to add, the one on 50th as well, then, if we're keeping this?
I think so.
Yes.
Okay, we can just add.
Yeah,
Oh, let's go to,
So
sorry.
the last one is the one that,
yeah, that's the one.
yes,
that's-
because that makes more
yes,
sense.
so-
I was thinking about this one last night and I feel like it needs to be modified, but I just am not clear how. And the reason why this came into the document was because we could see that there was a need when families are leaving shelter.
So the asylum seeker stuff, but here they are.
Right, but this was even before the asylum seeker stuff. When people are leaving shelter and going into, it's not even supportive housing, just regular permanent housing, not having services in place. And sometimes some families still require some of that. And so I was thinking yesterday that maybe it needs to be changed to increasing funding for supportive housing services for families. There's not a lot in the city, so I'm not sure.
No, this is the homes of the homeless that came to us, and they are specifically having for the 45th Street building. Doing that and making sure there's a contract to provide this, they call it like light service, or something like that. But the point of it is they need that, right?
I mean, to that point, I think you can even just say funding for discharge and supportive services, because it's part of the planning that they should have discharge planning about what's gonna happen when they leave.
And not the dumping that we saw.
Exactly,
Yeah,
exactly.
yeah.
And then the other thing in particular, expand, I think that there's a place in there to put things like service coordination and all of those things that also helps people get past certain things.
So,
Because it says GED and job training, but we are now hearing people need more than just that.
Yeah. So I think we can,
but how do we do it that it has an impact? Because we know we have it on 45th Street, there's the whole program came to us, right?
Joe, remind me what's on 45th, because I,
Homes for the homeless, the
Are you talking about
three buildings.
the Croman building?
Yeah, yeah.
That's services for the underserved.
Sorry, service to the underserved, sorry. Yes, SUS, thank you.
the ones that
Katie.
are closer to 9, next to
Yeah.
Schmetteries.
Across from,
How do I know
Yeah.
that?
yes, right, and they came with a whole specific program, which there was funding not only for the capital portion, for the rental subsidy and actual services. Right, so. Would it,
But that was for families?
yes,
I think so, for some families,
it
but I
was
think,
for families, yes.
but how do we, could the request be that we're for increasing that kind of funding for families? Supportive.
Right, we need to just focus it, that's the problem, I feel it's too general.
Yeah, it is.
Yes, Rachel or Kevin and Rachel.
So,
Oh, Rachel and Kevin. He's a gentleman.
Gentle lady and gentlemen are like, you leave.
But perhaps in discussion about specifying the need for, you know, the DOHMH request. I wanted to list from our previous letters, which Jesse and the office kindly uploaded into the drive. There was one letter that we drafted, sent out on March 2025 to Attorney General Letitia James about gender reaffirming care. This was a new topic that was brought to our committee's attention and definitely under threat and definitely deserves some light. So if we're looking for specific asks, and it does tie to family, family care, family planning, so something may be there, we can list out there, or it can be its own.
It would be under DOHMH, its own item.
We also get the slide tonight, there was a slide tonight about that they were saying that there are, in fact, I wrote it down, that there are grants that they're getting now that restrict their, in order to use the money, it restricts their ability to provide gender affirming care. So maybe there's something we can do, craft and ask that would be about providing funds that allows.
Well, say,
That
given,
supports healthcare providers,
just given given new federal restrictions in gender affirming care, the city should step in to support something like
And
that.
the city funds H&H does a good job of it particular, other hospitals does a good job of a particular issue. So we can make the ask to
H&H.
have the continued funding support and actually increase funding support.
Increased funding support for H&H specifically to provide gender affirming care,
Given XYZ, right?
So that'd be new and expense.
That.
Well, but it's interesting, go up to the top for a second, right? We have a lot of agencies now in the expense side, right? It's not just one.
No, but never.
We have many. We have Department of Homeless Services, DHS, DOHMH, that's number 2, HPD number 3, Housing Authority number 4, DIFTA number 5, keep going.
That's HPD.
So we have again, you sort of speak.
Oh, and the last one,
No, and
HRA.
HRA number 6, and now H&H number 7.
Yeah,
So
I mean, that's what you're gonna see, so you're gonna, that's good, you're
That's okay.
covering all agencies.
So I had two suggestions, one which Rachel raised, I couldn't agree more about that. And second, I get mixed up with this committee, our Chelsea, I'll get your language, but we had a good discussion, I thought, at the budget meeting. With having the city do a study. With all the past, ongoing and future building that's going. The needed services for the community, with the 200.
That is land use committees and DCP. That's what that belongs.
But we're
You're
definitely bringing it up
different.
at health kitchen land use tomorrow.
Yeah.
But you're saying that you're saying the point of being that one of the focuses of that study would be the impact on health services is what you're implying.
It's everything.
Yeah, but I think it would still fall under that.
We'll have this discussion tomorrow night.
Because that is their mandate, actually. DCP should be actually doing something.
So
called
real quick, I
planning.
understand is, I think the question is that what Rachel is suggesting is, and what Kevin added into, which makes sense to me. We're saying that's gonna go to DOHMH,
To health and hospitals.
Health and hospitals.
but they're not listed. Health and hospital is not on this list.
A state.
I mean, I'm just saying, like, the document the drop down menu does not list.
Oh, in terms of being.
I can say other, and in the description, I can say health and hospitals, but if there is a.
I think that's important to do it that way, because we know where to target it.
Okay.
Because all these things have to have the land somewhere, as opposed to DOHMH saying, oh, we don't really do that too bad, but we know.
Oh, I'm sorry, I don't get it. So H&H doesn't receive city funding?
It does, but it's not a city agency.
It's not, what I'm saying is we write this document,
It's a public.
the back end of this is I had a drop down menu of
No, I
agencies.
did that, yeah.
And so health and hospitals is not listed.
So what city agency is above it, or is it?
Yes,
It's
there
a
isn't.
public benefit corporation established by state law.
Well done.
Okay, and it's a creature of the goddamn city too, okay?
Huh.
So,
Okay.
so I think Jesse's,
Yeah.
it's the other angle, simply because it makes it clear and focuses it.
It also doesn't mean you have to prioritize it.
Yeah.
Department of Health.
All right, so let's go through quickly on expense and prioritize, if we don't like this priority of our first agency, go to the top, please, Mr. There you go. Actually, we have DHS, only one, right?
Yeah, you only have one in this. So I'm trying to say, the only thing you have, I think, double of is
HPD.
HPD
And DOHMH.
and DOHMH. So again, we're talking about one or two. So, I mean, I don't know how, you know, it's up to you guys, if you really wanna argue.
I would leave the priorities how they kind of fell out here.
I think so.
Because it's not as if we have 17 items under an agency, we have one or two.
You're gonna be sending each of these.
Yeah.
Is this where we add the stuff from tonight?
I
No,
think
that's capital.
those are capital, the machines.
Yeah, I knew we were experiencing expense.
Yeah, we can move the capital.
So wait, no, let's first set up on this. So we're adding on the H&H item, which is gender referring care through other hospitals. We're leaving the order within each agency the same, if it's 8 and 20, whatever it is, right? And have a bunch of clarifications that we have notes on to make calls and check on this. So on the expense side, the committee members, everyone feels with these changes, are we okay with this? All those in favor, please raise your hand. All those opposed? All, you didn't get P&E yet. All those, now you're P&E, well, all those abstained, yeah, this is Ryan. Yeah, you're in favor of the P&E on X. I think it passed unanimously with one P&E. Okay, let's go to our capital. Mr. Bodine, if you please. Okay, now just scroll down so we can see how many we got.
Not that many.
Not that many. Okay, so here we are. So here is the first item. And it says they're gonna do it. So that normally means we take it off here and put it on continuing support. That's our standard process. These are interim repairs in NYCHA, Fulton, Elliott, Chelsea.
And I believe this was like a joint,
Yes.
one from last year, so Flu will also take it up, so
Okay.
they have to reconcile whatever.
So sorry, you're saying you wanted to move it.
Well, we move it, we put it on continuing support, which says,
That's fine.
they said, they've agreed. When they agree, you don't support it again because they agree.
And continue to support makes sense.
Right. Next item is Harbor View. That's housing. They keep saying, oh my God, look. They're gonna be expensive, like, really? So, yeah, it's an obnoxious thing. Next,
Just sort of clear for anybody's background on this. This is our night development that's in Hell's Kitchen. And the board, way before my time, worked on a whole plan, entire plan with the community, with everybody involved for development to build new housing, not NYCHA, but new housing on the site that would also then obviously benefit NYCHA.
and predominantly affordable.
Yeah, predominantly affordable. An RFP went out. We also got a developer to commit $1 million, which I know is not huge money in development world, but it is still $1 million, and that's to the future development of it. The RFP went out, and then the city did nothing with it.
No, it was awarded.
No, it wasn't.
No, it was awarded. It was an RFP when I was awarded. You're forgetting a piece of this. Developer kind of got indicted. So then it was pulled back.
I get that.
Well, yes, okay, yes.
Yes.
The initial RFP.
The first developer got
Yeah,
indicted.
Yes.
Well, let me say, the feds went and took the computers out of their office, so they were not gonna get that RFP.
Right, yes.
So now the set went out again, and it got put out there,
I was thinking.
and it was about, and it was about to be awarded. And then we all went to a very strange meeting in City Hall. And when the new mayor, Bill de Blasio, came and said, by the way, you spent the last 5 years putting into this whole plan, got full community consensus, got the NYCHA tenants to agree, everyone to agree, like the officials to agree, everyone signed up to it. Instead, we'd like to build, instead of a 22-story building, a 65-story tower.
But then also the change of affordability when.
And it would be an 80-20, mostly market as opposed to mostly affordability. The thud that was heard in that room, I think I physically restrained Gail Brewer from jumping across the table and throttling someone from the mayor's office.
Why? And so either, we're basically saying we're keeping it.
Right, I think we're keeping this. And so I will tell you that there is though some talk about trying to revive this again at City Hall. I think with Adam's going, it's not gonna happen. Next one, this is, Maria, do you know, have these items been
This, I do not know.
okay, so we need to find out about this, we just don't know, we should have asked them.
You seem pretty outdated.
I mean, it does feel like if they didn't ask for them.
Yeah.
Right, yeah.
And the presentation was basically their budget ask.
And I just say,
Swap it.
I have learned never to believe that simplicity of information in this committee.
But I generally think,
We can ask. I will,
Gotta ask.
I will simply copy and paste this in an email and they will.
That's right.
Tell me whether yes it is, and they'll say. Yes, it is. It's not been funded and it's, our 16th priority.
Yeah.
And so we can just drop it down. And
Even the increase.
we can make we can make nice requests, the number we're going to say higher priority.
Yeah.
Now, the next one I can say I'm conflicted out on, but I was very surprised to get this last year. The project is still stuck, but at least they said they're gonna fund it. So I think this can go to continuing support also.
wait, hold on. Or shouldn't we add there?
We haven't gotten to the addings yet.
No,
We're reviewing.
Katie, what say you gonna say?
Ryan, the ones that we heard tonight that we agreed that we were gonna add in here.
We're gonna ask, we can decide on that in a second, but we're gonna ask them about these. We just didn't ask them tonight. So we'll send an email, say whether these are even, are these important to them? Are they less important than the ones that?
Or are they done?
I think we should
Are they done?
specifically ask that question, right?
Well-
You mentioned these three, which we've added.
Yeah.
And you have these.
But we haven't added them until we get to this
Yeah.
next portion.
I mean, again, either way, they are one or two of Department of Health.
Yeah.
It's two or one, or one or two, so it's not that big of a difference, we're not losing them either way.
I mean, if we keep it, I assume they're going to sort of restate their need. If we keep it, we probably need to change the language because it refers to
Yeah.
hydrant.
Yeah.
Yeah.
So.
So Hartley House, we should continue to support because they actually said they're supporting it. With that they fund it. Next one, this is additional space, which they brought up today. And I think we just leave it as an ask.
Yeah.
Is there anything else?
Clearly listed it, so it's not really.
That's it, right?
But-
Is that it?
Yeah, that's it.
Katie, is there a motion to add some items in? Okay, sorry.
There were two, like, Harborview capital asks. One is about the elevator,
Mhm.
one is about the rest of the items. But it indicated, I don't know if we have confirmed this in Harborview, that the agency has done or
Go up.
it's working toward the non-elevator. So this is agency supports and can accommodate NYCHA requires capital funding and it seems the way that they are describing it, and if I'm reading comprehension is failing me at this time, that they are, like funding this over time, the things that we have asked.
I think we need to find, again, this is
Would we need to reach out to Harborview or like, is there someone to reach out to on this for more information?
I would reach out to Joe Brewer and Maria Guzman. Maria Guzman's the president of the Tenant Association. She is intimately engaged with all this stuff.
Sorry, not to interrupt, but we could do that and decide if it
Yeah.
needs to be moved to continue support.
Right, or an aspect of it can support, the other one stay on. So, go to the top. So, sorry, Katie, you had a motion to make.
Yes, I move that we add to this list and actually. The number one, maybe, 3 asks. Which would be for the requested funds for inside the mobile van. And the $2 $7,500. Images.
The 60,000 to outfit the mobile van for equipment, the 7,600 for the intraoral exam machine, X-ray, and the autoclave for 7,400.
That's it.
And that would be under DOH and H, we'd make that request.
Right. And now, didn't you say?
For the purposes here, yes.
Okay, you want it.
But you said you want them to be 3 separate asks and not one single ask, or did I misread that?
Oh, no, I meant I wanted to have those 3 asks.
Oh, in one.
Add it on as a new item.
And of the 3, I think they said that the emergency. Assistance is the highest priority.
Yeah.
So maybe we lift
We'll just
that
put
up.
that first.
Yeah.
I think.
Yeah.
Yeah. In the political dance of the budget. So that means we have, Jesse, Housing Authority, we have 2, is that correct?
Yes.
Go down. No, well, the one goes away, that's it's being done through PACT, right?
Yeah.
We have DOHMH. We're gonna check as Ryan. Hartley goes to continuing support. And
change.
yeah, so I think we got it. We have 3 for DOHMH, which is the role Ryan, right?
Yeah.
And the others are for
NYCHA and
NYCHA.
HPD.
Yeah.
Yeah.
How's that?
All right.
And
People follow?
did we want, Katie suggested that the LHMH priorities, but that this, the new ones, that the new one.
I think
Do you, or?
we should find out from Ryan first what's going
I
on.
mean, I think they came tonight and said this was their priority, so I think
Yeah.
you saying this is, tonight's thing was number 1, and you could make this number 2. It's really not that big of a jump. It's not like they're saying it's 6, it's like it drops down to like 34.
I just want to know that we have specifics here and we need to understand where they are. We don't have the information. So given pending the clarification from the various requesters, all those in favor of this order? All those against? All those present and eligible on 1 item or 2? All those,
Ryan, I'm being.
and anyone abstaining? Great. We have now completed our budget. Very good request, and it was really tough. Do you have anything else?
Can I just mention something super quick?
Yes.
So there's a CAB meeting for the,
Oh, yes.
Drop it center.
no,
Nope.
the women's shelter.
The Ramada on West 44.
Thank you, West 44, and I typically go to those. The next one is on Tuesday, October 21st, and I can't make it. Is there anybody who is available to attend the CAB meeting for?
At what time does it begin?
I believe it's at 5 o'clock on that Tuesday.
I'm starting the budget task force.
Oh, well, see, I can make it
Yeah, no,
on Friday.
you did.
Yeah, 5 p.m.
No, we're at the budget task force.
Yeah.
Can someone else attend Katie's tab for her?
Exactly, if somebody else attend.
You're not, your job is not to present on anything.
Are we looking at
Just
Kevin?
represent the-
Kevin's on the
Kevin?
budget task force. We don't want to.
Oh. So anybody not on the budget task force?
Liam?
5 p.m.
I know, Leah, I know. We have jobs. We have these things that are jobs. What day is this?
Tuesday after the 21st. And there's a new executive director there.
Yeah, so this meeting is.
It's a video recording.
It's.
It is. I think they said it's gonna be both. It's definitely in person to meet the new executive.
I think you want to, have somebody.
Budget task force is at 6:30 p.m. So if, and
You can leave early.
yeah. No, I mean, so
Oh, I
if
didn't
you
know
are going to
I
the,
forgot.
if the cab's at 5, then you, I mean, if Kevin is really.
Did you say you wanted to go?
I do.
Okay, go at 5.
Would you like to go?
Listen,
I think that Maria's covering that.
No, wait,
It's Maria covers all
does
of it.
anyone have interest in doing that? It's a great opportunity to,
Yeah, it is.
take notes and represent our.
the truth is, I was gonna try hard to attend, but I think it would be good if somebody else could. As well.
I think Maria stands nominated, covered by Kevin.
Yeah.
I second.
Okay.
I have one other thing.
Yes.
Very quickly, so obviously we're in a new space, right?
Oh, she explained this whole, yeah.
Yeah, so I just wanted, I brought this up last night, so, Clinton Housing Development Company, this is one of their buildings. And we used to hold meetings in this space all the time, for members that remember this.
Housing
space.
and include.
Housing and Clue all the time, and so, we're reusing this space, it's a great space. They've been very generous with us and allowing us to use it whenever we need it, basically. The only kind of things that are the rules is that it does get used by the community, by the residents in this building during the day. There's a knitting group, there's Clinton admin meetings happening here all the time. There's cooking and there's a kitchen right here. There's food and all sorts of stuff. So we do have to clean it up at the end. We have to make it all look nice. And so one, just, if you can just, take everything with you that you come with, but, I'm gonna, I will hope to be here to set up for this meeting every time we need meetings. Today, this week is 4 meetings. So, but I'm not gonna be here with breakdown. So I'm asking each, committee to appoint somebody to break down them stuff, which is basically the owl, the projector, the laptop. It goes into this nice little locker that's on wheels. There's a key, it's at the front desk, there's a little couch. I have instructions, I wrote a whole memo about this, you'll love it. So, I sent it to Maria and Joe already. If you guys can just, you don't have to decide right now, but if someone wants to just be able to say, Rachel, fine, thank you. Rachel will do it, and so, that's it, thank you.
And we leave chairs back, like, you know, like classroom a little bit.
Yeah.
Any,
You don't have to touch the screen, that's the one.
there are some members of the public here.
Yeah.
Sir, were you here for a reason specifically? Introduce
Well,
yourself, who are you?
Yeah, so I'm on a condo board on a building that's right on the cusp of community board 4 and community board 7. So I'm actually visiting both community boards. And every year we have our annual meeting, and I've sort of been asked to keep our community informed as to what's going on. And so there were a couple of things in our community that I was going to ask Jesse about. I don't think this is critical as all the other stuff is, but I feel odd about, bringing this up, but, one of them is, the Windermere building, which, I mean, every year our residents are just constantly.
I had no gray hair when I started working.
Yeah. And
Yeah, I mean, I'll give you the very brief update that we got. I mean, and maybe Joe knows something better, because he keeps his ear to the tracks better than I do. The end all be all is that unfortunately, there's no progress. I mean, the building obviously is much better off, it looks much better off on the exterior, but then there's no deal. I know DOE looked at it, I know.
No, there's a deal. It's a zoning deal, but.
No, I meant like there's no progress in the sense of, right, they can make it into an office building, they can make it into a hotel. They did a ULIP that gives them that flexibility, but right now there's seemingly.
Can I say bluntly, the owner has more money than God.
Right.
And has no reason to do anything because he can just sit on it. When he does do something eventually, a portion of the building, the 406 portion furthest west, is like 18 units of permanently affordable housing. It's part of the harassment cure because there was violent harassment there, as you know.
Right.
And until they pull the trigger to do development, nothing will happen there. And it is the oddest thing to think that a building that at this incredibly visible location has nothing happening.
well, it's landmark, right? So
It is landmark, it cannot be demolished, it had to be restored.
And it has the housing, that affordable housing.
The affordable housing is attached to it as a deed restriction, they can't ignore that. However, and they can build some, like a floor, like a penthouse on top. The amount of time we spent on this building over decades is.
Yeah, I've seen your, I've, tuned in over the internet, so wow.
But you didn't sit in a meeting like this where I sat where the managing agent had a gun in his pocket. Back in the early 1980s, yeah, this was a whole different world then.
Then the building literally
Became
across the street over what used to be the Hudson Hotel, that seems to be.
We can tell you a lot about that offline, it's come to this committee multiple times, and they're coming back to this committee in next month.
Next month?
Yes, and there's a whole change that has happened, we can talk to you briefly at this meeting.
Okay.
Yes.
Are you in the building adjacent to the one?
No, two Columbus Circus.
No, it's 2 Columbus Avenue, it's right on the corner of P9 and where 9th Avenue becomes Columbus Avenue. There's a church right next to us.
Yeah.
Others, sorry,
Joe, I'm a resident of this building.
name.
Or Philip O'Loughlin.
Yeah.
I have a quality of life issue to discuss with you, among other things. It seems like in this area, I don't know, it's post or pre-COVID, it has gotten progressively worse.
What do you mean?
Be more specific, Ethan.
Well, if you take a stroll around this neighborhood, day or night, you will see vagrants literally strewn on the sidewalk. On the sidewalk. Day or night, they have, and the same guys all the time,
On 8th and 9th.
both areas.
And in the mid block too.
Yes, and I've lived on this block for 21 years. And I've seen the difference. Secondly, there's a row of buildings around here, mostly equity owned, they're mostly corporate owned, all this real estate. It's nothing but fraternity row here.
You wanna explain about the parties, give some more background? No, here,
Yeah.
let's say what it means.
They're frat boy parties that occur there, as well as raves. All night long, loud, confidence music.
So this is something that, as Jesse's been trying to do
This
before.
neighborhood has changed drastically for the.
There are two buildings that are being rented out for very transient people. And they have, I'm not kidding, raves in the backyard
It got worse during COVID.
until like 5 a.m. kind of thing. So this is this is a true serious quality of life issue, and it keeps everyone up.
Thank you, I'm glad you.
I'm very good.
During COVID, it was weekdays, weekends, regardless. And what it was they rented Airbnb.
Right.
They rent them out solely to have their.
Bill, what addresses?
From 309 onward, all the brick-based buildings on that block.
It's a row.
It's a row, exactly.
It's on this side of the block.
Yeah,
Exactly. And those buildings historically have been an SRO that was
but they
connected.
rent them the party.
Yeah, and there's a huge yard, and there's a back house and everything, so it is, one company bought the whole row. And now it's created this major problem. What time, when do you hear the parties happening? So I think this is
It
something.
could be random. They come in, get their freak on, whatever, leave, come back, another group comes in, and men and women screaming like banshees.
What day, what days of the week mostly?
Randomly,
What hours starting?
randomly.
Okay, you gotta give us more of a hook hanger hat on.
Oh.
Cause I mean, this is a police matter too.
Please don't come.
They don't come.
They don't come, this has been an ongoing issue, trust me.
And I've spoken to people here, they're annoyed, they're pissed off about it. And it seems like this is the area to go to party on. As far as fraternity row, all the college kids, this is the area.
And this is Midtown South Precinct.
Yeah.
Right.
It's designated as party row here. And it used to be so residential.
And I remember in the past, you've done some like reportings, did you have any of those recently?
I've got photos.
Okay.
As a matter of fact, they put up their lights and everything, and they have these bullhorns. I mean, I work split shifts, man, you know, I can work days, nights, what have you. And then people, they're pissed off.
So you're lucky on one thing, Jesse has been working out of this space also. Can you just arrange, we'll talk afterward, come down and let's get copies of those recordings, so we can really bring this to Midtown South? To deal with, this is an ongoing issue that's not been resolved for.
Well, they've got vagrants now moving in, apparently with this drug facility they have here, whatever it is. The exchange of needles, what have you.
What needle exchange?
There's an area right up this. It's over here in this area, they come over there and get their.
We have one on 37th Street, that's a needle.
One of those areas for that.
Right, but it's not right here. It's
No, not adjacent
okay.
here, but it's there.
Okay.
So they pick up their paraphernalia, they come over here and literally shoot up. I've seen them on the stoops. There's a guy across the street with a no trespassing sign there. These
So-
guys are literally on the stoop.
By the way, Phil,
Disgusting.
you're not alone here, we have this up and down the West 30s.
It's disgusting.
Phil, let's Joe and.
And I'm an old New Yorker, I've been around since the 70s, I saw bad things, but this is absurd. And then the cannabis shops, they all buy their cannabis, sit on any random stoop and smoke away.
So there are two locations to bring this up to, one is the precinct council, which we work with all the time, and the actual precinct itself. So we'll talk right afterward.
Yeah, because, it's sad though, it makes me wanna move out of New York City.
Don't give up.
Really. and I'm a native New Yorker. I've been here since the sixties. And I remember this area as far back as '79, when it was an ethnic enclave, where you had all sorts of people. Now that's gone, it's all corporate. It's all corporate.
Thank you. Let's talk more about that.
I'm sorry, I'm a little bit.
No, no,
you know.
It's okay. but
We're all
just
pissed, don't worry.
for Mr. Time for us to wrap up.
Is there a motion to, yes,
Yeah, my name is Matthew Robinson. These are the approach areas. These are the sampling of the floor plans of.
that we have to secure, right?
Good. That's the one for you.
Yes.
I'm sorry, Joe.
No, don't be sorry about it. You have the right to sleep and not have a rave down the block every.
They don't
days.
care, these
I
kids.
know.
They don't care. They rent out these places for a weekend of
Somebody
party.
make a motion.
That's all they do.
Motion to adjourn, we'll talk to you right there. Thanks, everybody, thanks for everything. Thanks.